All right, we will bring the meeting back to order. Thank you for our patience for the lunchtime vigil. It started a little later than anticipated, so it went longer for our lunch. But I appreciate your patience. The next item on our agenda is item J, but that's going to be heard with items L. So we will hear J with L and skip over J now, and we will go to item K on our agenda and do that next. Item K is the American Rescue Plan Act Coronavirus State Fiscal Recovery Fund Statement. And I believe staff will start, and then we will go to the GFO.
Thank you, Chair Monroe Moreno, members of the Interim Finance Committee. For the record, my name is Brody Leiser with the Fiscal Analysis Division. I will walk through agenda item K1, a statement of American Rescue Plan Act Coronavirus State Fiscal Recovery Fund obligations and remaining unobligated balance. The table has been provided as a separate handout outside of the meeting packets. Members should have a hard copy. There's two very similar looking legal size documents that the committee has. The one I'll be working off of in the upper left-hand corner says agenda item K1. This also is available on the committee meeting webpage, listed under meeting material agenda item K1. As you may recall from the October meeting, this table includes a high-level summary toward the top of page 1 that demonstrates the actual expenditures for fiscal years 2022 and 2023, as well as the amounts currently authorized. The amount that's shown under currently authorized also includes the items that are pending consideration by the IFC today, and then the remaining unobligated balance. If all requests submitted for consideration today are approved, there would be approximately $25.2 million remaining unobligated. As a reminder, funds must be obligated by December 31st, 2024, and must be expended by December 31st, 2026. There were a handful of minor revisions to existing rows on the table since the October IFC meeting, and those are identified in red text in the notes column on the far right of the table. The items submitted for presentation to and/or consideration by the committee today begin on page 22 of the table document. There are two work programs submitted as informational items under agenda item J, and there are 22 work programs submitted for consideration today requesting the use or transfer of coronavirus state fiscal recovery funds under agenda item L. However, item L6, as Ms. Kaufman had indicated earlier this morning, has been withdrawn at this time. The items being presented to the committee today include requests to address forensic mental health capacity needs of the state, to assist state agencies in recruitment efforts to fill vacant positions, purchase various equipment, and requests to transfer and/or align authority in order to carry out previously approved projects. Madam Chair, that concludes my remarks for this agenda item, and I'd be happy to answer any questions that the members may have.
And members, this is an informational item. Does anyone have any questions for Mr. Leiser? All right, seeing none. Here in Carson City, is there anyone in Las Vegas that have any questions for Mr. Leiser on K1? Not seeing any hands raised. Then thank you, Mr. Leiser, for your report. And we'll move on to K2, the status report on the administration obligation and expenditures. Invite our GFO to the table. Good afternoon.
Good afternoon. Thank you, Madam Chair and members of the committee. For the record, my name is Amy Stevenson, and I serve as the Director for the Governor's Finance Office. First, I would like to apologize for the lateness of the report from the Governor's Finance Office. With the dynamic nature of ARPA funds, I wanted to ensure I provided you the most updated information, as I know it was a concern at the last meeting with the data being 60 days out. I was trying to get it closer to real time as possible, but I do recognize the need to review before the meeting, and I'm working on refining the process so that it allows that time for review before this meeting. I am dedicated to getting this information right so that we ensure we spend all of the ARPA dollars and don't give any of it back. Enclosed, you will see a statement. It looks very similar to Mr. Leiser's. I actually use this as a template to help for ease of information so that you can compare apples to apples instead of the spreadsheets that I have been providing. It shows the summary of each allocation as of December 11th, 2023. Hold on one second. The only difference is the GFO statement has an extra column, which has the 24 actual expenditures as of 12/11/2023. And then the notes column will have information regarding status and next steps. As of December 11th, 2023, the Governor's Finance Office shows $26,072,900 in unobligated authority. So I'm a little off from Mr. Leiser, but we still need to reconcile as we are aware of some deobligations that will come to February's IFC for projects that have been completed or that were requested by the agency to be deobligated. In November, last month, the United States Treasury issued an obligation interim final rule to address the recipient's questions regarding the definition of obligation and provided related guidance and clarification. The definition of obligation has been updated to allow a recipient to use state local fiscal recovery funds to cover costs, i.e. payroll related to reporting compliance, monitoring, and single audits that take place after December 31st, 2026. To take advantage of this additional flexibility, we must calculate and justify the cost and submit a report to the Treasury by April 30th, 2024. Recipients may not include within this estimate any expenditure that is made after December 31st, 2026, other than administrative expenditures necessary to close out the state local fiscal and recovery funds award in accordance with the uniform guidance. With the new obligation guidance from the Treasury and after legal counsel, the Governor's Finance Office has some concern regarding the state's ability to meet the federal obligation requirement for state personnel costs that go beyond December 2024 that are not related to compliance efforts. For program personnel, a legal obligation incurs after they have actually performed the work. The Governor's So this affects approximately 105 FTEs for the last 6 months of the second biennium is what is considered non-obligated because they haven't done the work yet. With that, 83 of them are vacant and are on the agenda today. And I have talked with DHHS, and I have talked with Director Whitley, and we possibly can move those to contract staff, and that way they would be obligated so that they can perform those services. With the remaining 22, 3 of them are vacant, so we're talking the impact is 19, and I am working with DHRM, Director Whitley, because most of these are with DHHS, to place those in either currently vacant positions or find other means, but they will be held harmless. There will be no adverse effects to those employees. 146 advance payments have been submitted for processing. The Governor's Finance Office is working on a separate reconciliation to reflect how much of the advance funds have been spent, and that will be provided along with this summary at the next February IFC meeting. With that, that concludes my presentation, and I stand ready for any questions you may have.
Thank you for the presentation. Members, any questions? I have a few, but are there any members here in Carson City or in Las Vegas with questions? All right, not seeing any. So Given what you just said, with the updated definition of the obligation from the Treasury, can the state fund positions cost after December 31st, 2024 that are unrelated to compliance efforts with the American Rescue Plan Act?
Thank you, Madam Chair. For the record, Amy Stevenson, Director GFO, no. The answer to that is no.
And then, since we wouldn't be able to do staff past that, how would changing it to contract staff beyond 2024 affect that? Would we be able to pay that contract after December 2024 since they're not compliant?
Sorry, thank you for that question. Amy Stevenson, for the record, Director of GFO. So contract staff, because we would be entering into a long-term contract for a duration of time for contract staff, the federal treasury considers that an obligation. The difference with the state FTE is you are not legally obligated to pay an employee until they work. So they have to perform the work before we're legally obligated to pay them, and that's the definition of obligation for a state FTE.
All right, I have a few more questions, and you may have answered them as you went through, but I want to make sure we get it on the record. With the new information that we have and the concerns about funding positions that are not related to compliance efforts after December 31st, 2024, could you indicate whether it would be appropriate at this time to approve agenda items L17, L18, which would include authority to support those 83 FTEs, positions beginning in December of 2024, and then also contractor positions in L20 because they extended to 2025. I think you just answered that, but I just want to make sure.
Thank you, ma'am. For the record, Amy Stevenson, Director for Governor's Finance Office. I would say it is not appropriate for the 83 positions, but it would be appropriate for the 20 contract positions based off of the new definition for obligation from the state treasury.
And then my next question, also in List L are the GEL pilot program, right? So with the concerns that you have with the personnel costs, there's been the request to fund as part of that 2-year pilot for GEL-based programming efforts in Clark County and Washoe counties, which would go beyond that December 31st, 2024 date. Would we still be able to do that, or should that not be approved? Would that meet the new definition of obligation?
Thank you for that. For the record, Amy Stevenson, Director for Governor's Finance Office. I'm going to have to say that depends. It depends on if we're going to contract specifically with Clark County and Washoe. Then yes, it would meet that definition because we are going into a subaward, so we're obligating those funds to an entity, or we're going into a contractual agreement with another entity. So yes, we could do the pilot program if we're giving the money straight to them. I don't know enough about the program. I'd have to get with Director Whitley, but yes, based off of what you just told me, yes.
Okay, so we would be contracting with the counties themselves, and then the counties would hire the staff? We wouldn't be hiring the staff, so that's why we could move forward with that program?
I don't know I'm sorry, Amy Stevenson, I don't know the program well enough. I'd like to talk with Director Whitley before I go and make a statement on that. But so for obligation, if we contract either with a third party or a local entity or go into a vendor, it's considered obligated. It's just the state FTE that we have concerns about because it's not considered obligated till they actually perform the services. So if we go into a contract with contract staff, it's considered obligated. If we go to Clark County, Washoe County, and give them the money and they hire the staff, it's considered obligated, if that helps.
Okay. So most of the things in List E we could, when we get to that discussion, move forward with them, but we definitely should not, at this point, move forward with L17 and L18.
Correct.
Okay. I know that there's a few more questions. I will have a request at the end of the questions, but I'll go to Senator Nguyen. I believe you have a question down in Las Vegas.
I do. Have you had the ability, or have you had the manpower? Have you started to go through things that we passed during the legislative budget during session that are impacted by this new advisory, I guess, opinion from the Treasury regarding these ARPA funds? Like, do we know what other programs are potentially impacted that had state employees that were funded through, I know, through 25?
Thank you for the question through you, Madam Chair, to Senator Nguyen. Amy Stevenson, Director for Governor's Finance Office. We have gone through those, and the 105 employees that I mentioned earlier are the impacts to this new guidance or regulation.
And so that's inclusive of everything, is those 105?
Correct. Yes, ma'am.
And does that 105 include the 83 requested in the work program, or no?
It does. Yes, ma'am. Amy Stevenson, for the record.
Thank you. Thank you, Madam Chair.
Thank you. Assemblywoman Anderson?
Thank you, Chair, and thank you for presenting this information. I really appreciate the notes, and so you might have gone over this a little bit, but if you could extend or clarify a little bit. As I'm looking under the notes, there are numerous items where it's 0% complete. And then needs spend plan by 12/31/23. So I can't wait to see all those spend plans being written at 12/30 on literally December 30th. But what's going to happen, and first of all, in our February meeting when we finally get to see that, but then also what's going to happen if they are not, in fact, there is no plan, or worse yet, as is the case on page 9 of number 52.75, if there's a supply chain delay, which is what happened with, it looks like, our the governor's office. Oh, the governor's office. Hey, so now I guess there is a reason for our chief of staff to have to come down here, but that sort of idea. What's going to happen if there is in fact a delay due to the supply chain?
Thank you. Through you, Madam Chair, to Assemblywoman Anderson. Amy Stevenson, Director for GFO. By that 12/31/23 spend plan date, that is when the governor's office can relook at de-obligating from some of these programs if they can't get them off the ground, or they can't get and then come back and reallocate them at the February IFC.
Thank you for the follow-up. So does that then that has to come back to the February IFC, and it would be, I hope, given to us a little bit earlier than that day, possibly, but also understand there's some other times. So there would be a reallocation under the same department, or would it be anything at all within the state?
Thank you. Through you, Madam Chair, to Assemblywoman Anderson. Amy Stevenson for the Governor's Finance Office. It could be any, as long as it fits in the right bucket of money, revenue replacement, public health infrastructure. So it could be for any agency as long as we fit within the buckets.
Thank you so much, Chair. Thank you.
Thank you. I believe the Majority Leader has a few questions.
Thank you, Madam Chair. And I think that Assemblywoman Anderson asked a couple of the ones that I had, because again, I think there are a lot of spending plans we need to receive in like the next 2 weeks. That's a short period of time. Not with respect to the vendors, but do you have, like, are these agencies aware? Are they in the process of providing those to you? Do you expect you're actually going to get those by the 31st?
Thank you. Through you, Madam Chair, to Senator Canizaro. They are aware, as my ARPA team has been having monthly meetings with agencies, so they are aware if they're not spending, or we have, it's a long day, sorry, brain is not working. So they are aware, and I hope to get them. I'm also, because this is all coming, new information that's coming kind of quickly and right before the holidays, I have scheduled an all-directors meeting next week so that we can go over the new definition of obligation. I can go through each project and really stress the importance that I need to know where you're at. If you can't spend it, it's okay, because we can spend it somewhere else.
And I appreciate that. My frustration on this particular issue continues. There's a lot of money here for things that were approved, that is not being spent, that we're looking now to get like spending plans on, large chunks of money that are going to be hard to sort of re-obligate to programs. I'm looking here at line 67, it's $30 million for childcare provider capacity expansion grants. And very little of it has been spent. There's $21.5 million left. That's just one item on this list, but it is like one of the larger ones that's just sitting out there. If there's an issue with how that is to be, and I know we talked about this during session, but if there's an issue out there that has to be addressed as to why that money is not going out the door, but we have no notes, no indication of what the issue is or why that's the case, that's a large sum of money to either A, spend in that period of time, or B, try to find another program that will be able to utilize that money in a way that is allowable under the rules and in a way that is actually going to benefit Nevadans. And it's for something that I think, readily folks here would easily agree that childcare expansion and additional slots on behalf of providers is an essential thing that Nevadans need. So it is frustrating to continue to come here. I know that you, Ms. Stevenson, are doing your best to get this information to us, but this is now the second meeting that we have had where we have walked in day of to get a packet that is very large, that is very detailed in all the ways in which we have spent it. It is thankfully different from the one we received last time, which had very out-of-date information, but now there's just sort of a lack of information or an indication that we just need a spending plan. I don't know if the issue is with the agencies not getting you the information or not taking this seriously, or if there is some other miscommunication, but we cannot walk in here to a February IFC meeting and receive this document on the day of the hearing because we have not had even a sufficient amount of time to review it at all. And where there is not any information about where this money is going or what the actual spend plan might be, just some notes about we're going to get a spending plan together by the end of the year, is very frustrating to be here so that we can be good stewards of this money, make sure they get to programs, especially because there was a lot of work done to vet these programs and say this is where we want to put some money. If they can't spend it, we need to reallocate that or try to make some different decisions, which I know you are aware of because we talked during session about this body not wanting to receive last-minute requests to re-obligate funds that were already sent to programs when we just show up and all of a sudden there's a request to reallocate money and we don't have any idea as to why it wasn't spent in the first place. And so I'm not trying to belabor the point too much or take out any frustrations on you personally, because I know you are doing a good job, but this has got to be, and it shouldn't have been this time and it shouldn't have been last time, but this has to be the last time that we walk in and get a packet that talks about all this money that's sitting here in programs to benefit folks that is not getting spent. That is not a way for us to do our job. It is not a way for you to do your job or for this state to serve the people of Nevada. So I, again, have not had a sufficient amount of time, I think, to go in detail through each one of these things where we have money sitting in programs that is designed to get out to folks, but we have got to do something to either make sure that that money is getting out the door, so let's figure that out, or we need more updated information well in advance of the next hearing, because I cannot continue to sit here and walk into this as a report that we're supposed to digest in this very short period of time. Thank you, Madam Chair.
Thank you, and I believe Senator Neal had a question.
Yes, Madam Chair. I am trying to read through the Federal Register and try to grapple this definition because the budget office memo is not sufficient for me to really understand this new terminology of what obligation means. And so I wanted to ask GFO this question. So in the Federal Register, it's saying that that one of the new changes to the terms includes reporting. So such expenditures can include the following: reporting and compliance requirements, funds expended to comply with SLFRF reporting and compliance requirements in connection with the preparation and submission of recipients' required reports, review of subaward reports, or subrecipient monitoring generally. So if a person is, or an entity or agency is on the cuff of creating a subaward or doing an RFP, if it is not solidified by December 31st of 2024, is it no longer an eligible expense? Because they're not in the category of actually in the review of an actual subaward or looking at a report or looking at the maintenance of the data for something that has already happened?
Thank you. Through you, Madam Chair, to Senator Neal.
Go directly to the member.
Oh, thank you. I'm not quite sure I understand your question. So,
You don't understand.
the
Okay, let me ask it this way. Because you probably don't have the Federal Registry in front of you. I want to know this.
okay.
If you currently have a project in queue, let's say it's on the sheet, but you haven't actually committed the dollars, you're in the process of talking to a group, you have an RFP out. That RFP will not be completed by December 31st of 2024, and it is related to COVID funds. Is that expense considered obligated?
Thank you, Senator Neal. If you are a state agency and you have not finished the contract, the RFP, or obligated the funds in by December 31st, 2024, it is not considered obligated. If a state agency subawards to another county and they haven't done the RFP or whatever, they are not subject to that same. It's the state agency that has to have the contract or subaward or whatever contractual agreement done by 12/31/2024 to be considered obligated.
Okay, Madam Chair, can I have a follow-up? Because I think I'm getting ready to have an experience.
You can have a follow-up, no experiences.
So I am trying to process what is being said. So, because on two fronts, right, at the beginning of this conversation, it's okay if the money is operating as a pass-through to a county, and then they obligate. But if a state agency is holding on to money right now, and they currently have not awarded, and I'm going to give you a clean example, because if this is at risk or being threatened in any way, I'm literally going to have a problem. So currently, there were pieces that we moved, whether or not it was in this document or that we had a blended RF money of ARPA funds that are expected to be obligated or expended by June 30 of 2025. And they are currently in the process of completing an RFP. That RFP has not been completed. Are you going and telling the agencies that they should either speed up the process, and if they don't have that RFP locked in, knowing who they're going to deliver funds to, then that RFP process is then null and void?
Thank you, Senator Neal. Yes, I am going to them and saying that they have to either speed up the process or get into a contract by December 31st, 2024.
So are you telling staff that they need to, if they've gone on vacation or if they're talking about trying to find Christmas on December 20th, that they potentially need to stay in the building and do work to produce the end so that we don't lose certain amount of contracts or money?
Thank you, Senator Neal. We do have exactly 1 year from today to get into a contract. So I'm not saying they have to stay in the building today at all, but they have to get into contract by 12/31/2024.
Okay.
Senator Neal, did you have a follow-up?
Madam Chair, I am going to save myself. I am not going to enter into this conversation any further, but I am going to send a series of emails right now to some respective agencies to get a question answered.
Thank you, Senator Titus.
Thank you, Madam Chair, for the question. Director Stevenson, you did not personally authorize any of these expenditures. Am I correct that they all came through this body and approved these finances for these groups, whether it would be a legislative bill or whether it was through a committee ask?
Thank you, Senator Titus. For the record, Amy Stevenson, Director for the Governor's Finance Office. I did not personally obligate these funds.
Correct.
No.
So these funds have been obligated through a process that, and you are now in the position to hold these departments to try to spend this almost embarrassingly amount of monies that these agencies had to request in order to be authorized these funds. Is that correct?
Thank you, Senator Titus. Amy Stevenson, for the record, yes, that is correct.
Correct. So it sits on the agencies themselves, the authors of the bills, the people who directed these funds to the agencies to make sure that they get spent, in my mind. And it was a concern of mine from the start that we were throwing around this money like, frankly, it was chump change, and had concerns and questions during these hearings. How could you spend this money? What was your plan to spend the money? And I know that I have asked the committee staff to give us updates on is it even possible to spend this money? How are we going to do this? And I think this is what we're seeing now as time has passed, that the agencies are going to have a hard time spending some of this money. And I think our concerns are, at least mine is, that we don't want to leave any funds on the table. There are true needs in the state where we need to fill some of the stuff. And I agree, holding these agencies responsible, if they can't spend this money, then for heaven's sakes, we are obligated to put this money to these voids that we have on our states that we hear about every day. And so I appreciate that you're holding them to the fire. I appreciate that you're trying to give us updated information, and I appreciated the majority leader's comments about getting information on our desks the day of, because that's how I feel almost every day when every meeting I have as in the minority on this committee, about getting information at the last minute, the last day of, and literally had to ask that these books be shipped to me so that I had a chance prior to these committees to look at all of this information. So I share the concern that we need information in a timely manner, but absolutely appreciate that you're trying to give us current, because we give you a hard time when it's not current. And then when you hold out to 2 days or 1 day beforehand, it's too current. And I know you're kind of stuck in the middle, so I personally want to thank you for doing your job. And but again, having information, whether it be a spreadsheet, these blue folders, in a timely manner, so we as a body can make good decisions, ask good questions, reach out to the appropriate committees and agencies, as I think the good Senator Neal is going to be doing. I think it's our obligation to watch out for the taxpayers' funds, because at the end of the day, these funds aren't just some coming down from the sky. Everybody in this room put money towards these funds. And so I would hope that we all are very sensitive to making sure these funds are well spent in a timely manner with appropriate amount of information. So I just want to thank you for the information you did give us. And that was probably more of a soapbox than anything
Comment
else.
than a question.
Thank you.
Members, any other questions? Senator Gokachia?
And I'll be a lot briefer. I'm just wondering at what point or when in this process are we going to take a look at some of these clearly aren't going to get there. We've got other shovel-ready projects that are definitely, as my colleague said, definitely needs in this state. We've got some that are turnkey waiting in the wings. When are we going to take a look at those and say, hey, maybe it's time to reobligate? We can have this money committed by December 31st, and we can have it on the ground by 26.
Thank you, Senator Gokachia. For the record, Amy Stevenson, Director for Governor's Finance Office. It is the goal of both myself and the Governor's Office to have it right after the beginning of the year, after we have the spend plan. We want to give the agencies and the programs one last chance that if they can get it off the ground, they can get it off the ground with all the help that we can provide. And then if not, we will be, at the beginning of the year, we will be looking at those other projects.
Thank you, Madam Chair. And just a quick follow-up, if I may, then be prepared on February. Thank you.
Thank you, Senator Gokachia. Yes, every request, everything that's in this very long document, every last one was a bill or a request from a department that came through this body, but had to come through GFO's office to even get to this body. So I have a request, and I hope that every agency is listening, because we can't be here again. I think I've said it until I'm blue in the face, that I do not want to send any money back to the federal government. And we made a provision during the last legislative session to do that. But I'd rather not use that provision and have the money utilized for what it was obligated for, correct? So I'm going to make an ask of you, and every agency get it to the GFO in a timely manner, not before the February meeting, but right after the New Year's. Enjoy Christmas. I'll be working through Christmas. If you like to work through Christmas, go for it. But provide a report to this body, a detailed report of approved program allegations that include personnel costs beyond December 31st, 2024. In that report, it should include a description of the program, the agency that's conducting the program, the budget account, FTE information, including positions, titles, and counts, confirmation of whether positions are currently filled or if they're vacant, the total program award allocation, the budgeted authority by FY, and the estimated amount to support the positions beyond December 31st, 2024. And in that report, it should also include information as to the plans, and what those plans are to fund any of those positions that are otherwise budgeted to be funded with ARPA funds beyond December 31st, 2024. And then with all of the programs that we have approved, a truly detailed update to the GFO so that the GFO's office can report to us where we're at in those. And for the agencies to be honest with yourselves and with the GFO, if you cannot do the work, if you cannot get it done, say it now so that we can reobligate the funds and put them elsewhere. Do not wait until the last minute. This is bad for all of us. If you cannot get the work done, if the RFPs aren't coming in, you can't hire staff, or it's just not going to happen, then by all means, be truthful and honest to yourself, to the GFO, and to this body so that we can move forward. Any questions? All righty. Yes. Thank you. I know your job is not easy. We do appreciate you, and I hope you don't feel we were yelling at you. It's just a very frustrating position to be in at this point. But seeing no other questions, I thank you so much for the report. I look forward to seeing the next report.
Madam Chair, I
long
just have a quick
before-
question down here in Las Vegas.
Okay, hold on, long before our February meeting. And agencies get her the information that her office needs to get that information to us. Because it's frustrating. I don't care. It's just very frustrating. Assemblyman Nguyen.
Thank you, Madam Chair. Just quickly, just follow up on everything you said. It's way more eloquent than I am. I just wanted to ask the director in terms of, we have 2024 and that's 11 months away. And according to the director, when in 2024, because with all the reconciliation and looking at all the agency unobligated things and the remaining amount, like when is it the cutoff that you set in that office to determine that, look, if we don't have a plan by then we need to, alert, call all the bat phones. So do you set a time for yourself? Because obviously IFC, meet infrequently during the interim. So how do you, where is that deadline? I just want to hear it out loud that, by a certain time frame in 2024 that we must go and speed it up to 0.
Thank you, Assemblyman Nguyen. For the record, Amy Stevenson, Director for GFO. Internally, I have set that deadline, as you have seen on the report, for the 12/31/23, so that I can have conversations with the governor's office on what we need to basically either speed up or come back to this body for reallocation.
So obviously that's not, sorry, Madam Chair, if I can just do a quick follow-up, that obviously now we're coming to that deadline and that's not realistic anymore on 12/31/23. So is there a, new deadline that you're setting for yourself?
Thank you, Assemblyman Nguyen. For the record, Amy Stevenson, Director of GFO. I respectfully disagree that it's not an attainable deadline, 12/31/23, because we've been working with these programs for quite a long time. If they don't have a timeline or a plan by that time, then I don't know that they can get it off the ground. So I do believe, like I said, and I wanted to make sure I clarified, this is very new guidance for all my directors, my fellow directors, so I am taking the personal approach and having the meetings with them next week so that I can answer any questions that they have, address the new definition for obligation, what that means with RFPs, and help brainstorm so that if they can't get that information to me, then we can brainstorm to figure out, do we need to reobligate? Do we need to move forward? Is there something else that we have to do? So I hope that answers your question. Thank you.
So in the report that I asked for, if all of the agencies could have their information to you 30 days before our meeting, our next meeting is on February 8th, that would give you time to go through it all and get a report to our staff 2 weeks out, and that date would be January 25th. And that would give them 2 weeks before this meeting to go through it and give the members of this committee information in a timely manner before the meeting. Do you believe those are dates that we could whole to.
Thank you, Madam Chair. For the record, Amy Stevens said yes.
Thank you. Thank you. All right, members, so expect to see something in your inboxes soon, and staff to have it. So we would, late, can we get it to you late? No. The answer is no, so don't email me. Do not email Senator Dondero Loop. It's going to be no. The information needs to be to the GFO's office 30 days before our meeting. Our meeting is on the 8th, so that she and her staff have at least 2 weeks to go through it to get us the information to our staff by the 25th. So don't ask for an extension. The answer is no. Okay. Thank you again. Senator Spearman, did I miss you? Did you have a question?
No, ma'am. You answered it. You asked it.
Okay, thank you. All right, so with that, now that we know what type of money we don't have, we can go back to item J, and we'll hear that with item L. Item J is informational only, but I believe there's some questions about how that decision came to be. So, item J. So we're going to hear item J, and then with item L, it's going to be L 1, 2, 17, 18, 19, 20, 21, and 22. And we're hearing J 1 and 2. Good afternoon, and thank you for joining us.
Good afternoon, Chair Monroe Moreno and committee members. My name is Cody Finney, and I serve as the administrator of the Division of Public and Behavioral Health in the Department of Health and Human Services. I do have a very brief prepared statement that describes the plan that we are working and how these pieces fit together. However, if you'd prefer to start with item J, we can pivot to that as well.
Well, if we could start with item J and just how that decision was made, 'cause that's just an informational, then we can move on to L.
Thank you, Madam Chair. For the record, Ben Kekeffer, Chief of Staff to Governor Joe Lombardo. So obviously, item J was, forwarded as an emergency work program where we provided notification of the governor's approval of 2 work programs to authorize the expenditure of ARPA funds to purchase capacity in the community to free up forensic beds and increase the availability of forensic placements out of jails. So, and the decision was made to ultimately process this as an emergency work program following the discovery of risk to the community that the governor felt needed to be immediately mitigated with the availability of additional beds. So criminal charges had been getting dismissed against certain individuals who we felt posed a risk to the community that had proved out. And we felt like implementing this transfer to increase bed capacity immediately would allow the more expeditiously contracting with those community providers and making those movements so that we're able to effectively provide the restoration services that are needed to maintain people in an appropriate setting.
Thank you so much. I do have a few questions, and we'll start with Assemblywoman Senator Nguyen.
Thank you, Madam Chair. I have a couple of questions. I see that there are 11 individuals that are contemplated. Would that also create 11 new forensic beds for some of this ongoing wait list?
Thank you, Ben Kekeffer.
And how soon would that take place?
Yes, Ben Kiekover for the record, Madam Chair. So that's exactly the purpose, right? To transfer people out of long-term patients out of forensic beds to free up those individual slots for restorative services to free up backlog within our jails. And the additional benefit is that, you know, these 11 individual patients are there for permanently, basically, full year, not permanently, but long-term, so that it may be 11 beds for those 11 individuals, but for restorative services that may only take a few months, we're going to be able to process significantly more than just those 11 individuals through the restoration process by freeing them up.
Madam Chair, may I ask a follow-up question?
Go ahead.
As far as those 11 individuals, how did you select those 11 particular individuals for removal from their current forensic beds with the state into these potentially these private facilities? Did it have to do with needs? I don't know, the crimes even that they were committed, like, or, you know, that they're in there for? How were those 11 determinations made?
I'll defer to the experts on that one. Thank you, Madam Chair.
Hi, good afternoon. Ellen Richardson Adams for the record. I oversee outpatient community services within DPBH for mental health. Specifically to your question, those 11 individuals that were identified met clinical need for long-term skilled nursing level facility. They are both medically compromised and have behavioral health needs. And so we have completed a series of assessments, one being cognitive for their current presentation of cognitive with potential of decline. Second, to their physical abilities. Can they toilet independently? Can they feed themselves independently? Are they able to get from point A to point B independently? Most of the 11 individuals that we identified meet the level of need for a skilled nursing facility. So in simple answer, they're pretty much bedridden. Happy to answer.
And
any
then I have
further
a question
questions.
about, they are, obviously, we're essentially private paying them to have these skilled nursing facilities take these 11 individuals. Is there any way that they would be eligible for Medicaid, and in some cases Medicare, depending on their age? Or are these individuals that we will continually have to state pay for their facility in these private facilities?
Thank you for the question, Ellen Richardson Adams, for DPBH. Because they're considered to be in an incarcerated state, they are not eligible for Medicaid or Medicare under CMS rules. And so I've done extensive research to make sure that that is accurate. And even back in 2016, CMS provided some guidance to all the states as they saw that there was an increase of criminal justice intersecting with skilled nursing level needs. And so they provided guidance to the states on that. So at this time, we would need to continue to pay for them as a private pay because they would not be eligible for that payer source.
And I'm sorry, Chair, if I can just ask one more question about the financial aspect of it.
Go ahead.
Do you know how much this will, I mean, obviously these individuals, these 11 individuals are being cared for by the state currently. Do we know if transferring them to a facility that is arguably more equipped to deal with them and their medical needs will alleviate or free up any job responsibilities of our current state workers?
Ellen Richardson Adams for the record. That is a very good question. Thank you for framing it in that way. You have me thinking. I'm going to say yes, because oftentimes due to the physical presentation of needs, a nurse may need to help feed an individual versus somebody that's truly needing to be in the hospital. They can independently feed themselves. And so there is a skill development piece that a nurse or a mental health tech, et cetera, that wouldn't have to provide for that one-to-one. They'd be able to go back to their higher, 3 to 5 person ratio that they work with. And so I'm going to simply say yes, but that's a very good question, so thank you. And I'm happy to follow up on that at the next IFC or provide a status report to be able to demonstrate that so I can back into my answer or at least give you updated information. Thank you.
That would be great if you could do that.
And thank you, Madam Chair.
Thank you. Assemblyman Yeager.
Thank you, Madam Chair. I have two quick questions, one for the agency and one for the Governor's Chief of Staff. I'll start with the agency. This was already approved, so this is informational, but just curious, it's $5.7 million in ARPA funds for 11 patients. What's the time period on that? Does that cover the care for a certain period of time, say this biennium, a year or 2 years? Just trying to get a sense. I understand these are high needs patients, so they're expensive to care for. But what's the time frame that the $5.7 million covers?
Hi, Ellen Richardson Adams. Thank you for the question. The 5.7 is to cover for the duration of the ARPA time frame, and so it would be until the ARPA dollars are timed out. Happy to further answer that if there's more question.
Yeah, I guess I was just trying to get a sense of, obviously, if this is a long-term plan, or if there are going to be additional individuals who are transferred, there's obviously going to be a state obligation beyond the ARPA money into the future. And so just, I guess, wanted to get a sense, and this doesn't have to happen today, we can do this offline, but just a sense of what the actual cost is, and to Senator Wynn's question of whether this is a net savings for the state versus under state care. So I think I've sort of asked that question well enough, and we have to move on. So, Madam Chair, if I could, the question I had for the Chief of Staff, obviously this has been approved by the Governor under 353-225A for protection of life or property. And I just wanted to ask a question about that, because it seemed to me that these 11 patients before this was approved, and maybe they are still currently occupying long-term inpatient beds at Ross and Neal Hospital. So if you could just shed some light on what the protection of life or property was in this particular instance that led to the Governor approving it under that particular statute, please.
Thank you. Ben Kiecover for the record. Thank you, Mr. Speaker. Certainly not related to these specific 11 patients. It is the opportunity to free up the additional forensic services that will allow us to appropriately treat people who are charged with violent crimes and ensure that they don't get their charges dismissed and be released back into the community.
Great. Thank you so much, Madam Chair.
Thank you. And going back to Speaker's first question, that funding is just with ARPA dollars. What is the plan once the ARPA dollars are no longer there for the payment of care?
Thank you, Madam Chair. Ben Kiecover for the record. So this will be an ongoing process as we hopefully start reducing the wait lists in jails for provision of these services. And if there is a continued need to have this bed capacity available, then we would be coming back to the legislature through the budget process to propose a funding source for that. Ultimately, I think what you'll hear in the next work programs is that we're making significant progress in creating additional capacity, reducing waiting lists, partnering with some of our local government partners in creating a more comprehensive plan to address the need to provide more timely services to the patients who need forensic restoration. And it's just sort of a moving target by its very nature of healthcare. So we would address that through the budget process if there's a belief that we will need to continue to pay for these services beyond the life of the ARPA funds.
And then my next question, what is the average age of those 11 that moved? And it's kind of a morbid question, life expectancy.
Ellen Richardson Adams for the record, and understand the nature of the question. I'll give you a range. We are seeing anywhere from 40 years old to 80 years old. And so I share that because what we're seeing is some of the individuals, due to the complexities of their mental health, oftentimes heart disease, diabetes, et cetera, comes with that. And so there could be a decline in health. And so we're seeing that early onset, and then we're also seeing it with our older population as well. And so I do want to add respectfully, in addition to completing the physical assessments, cognitive assessments, et cetera, we also complete a risk assessment. And so we want to ensure that the individuals that we are reviewing will safely be in a community setting, and we will continue to monitor them. Like, we're not releasing them and like, okay, go. We will continue to monitor them. We will be in there at least monthly, if not more, because we want their placement to be successful. So we want to partner with the company and the facilities that are going to protect them. Thank you.
And that was going to be my next question, the risk to society. So thank you for that. I believe Senator Neal has a question.
Thank you, Madam Chair. So I have questions that I guess related to the other part of this issue, which are the L19 and well, really it's L1 and L2. So I'm going to shift this conversation to ask about the jail-based programming proposals. Could you guys please describe any changes, including anticipated personnel within the Clark and Washoe County jail-based programming proposals since the October IFC meeting with the Department of Health and Human Services?
Good afternoon, Drew Cross.
Before you answer that, and thank you, Senator Neal, for the question. I know when you sat down, you said you had an overview of List L. Did you want to do the overview before answering the question?
Thank you, Chairman Moreno. If it's helpful to the committee, I'm happy to do so.
Let's go ahead and do that.
I'll be
and then
very
we'll come
brief.
Back to the question. Thank you.
Again, Cody Finney for the record, Administrator of the Division of Public and Behavioral Health. From my team today, I have with me Mr. Drew Cross, the statewide coordinator of forensic services. You've met Ms. Ellen Richardson Adams, and Ms. Susan Lynch is at the table in Las Vegas. She is our hospital administrator at the Ross and Neal Hospital. Today, we have several work programs that are steps in our larger plan to address both the supply and demand for critical restoration competency services. In addition, these plans are designed or have been designed to use the time-limited ARPA funds before they expire. So you heard about our skilled nursing contracts. Building 3A is on our SNAMS campus. We're asking to renovate that building. It's 21 currently licensed psychiatric beds. The renovation will allow us to make sure it is safe for forensic patients. And that will allow us approximately, by freeing up the 20 additional beds, we'll have 60 short-term admissions per year. Ms. Lynch and Public Works are present to discuss those renovation issues if we have questions about that. We've proposed additional professional contract staff in the Lakes Crossing budget. This staff would work statewide to reduce the wait time between evaluations and thus the length of stay at our forensic facilities. There is downtime between some of those evaluations, and we've had good luck improving our staffing, and we'd like to continue that. And then finally, our jail-based programs, that is L1 and L2. This program is complementary to our inpatient restoration treatment services and will help the community to manage the demand for inpatient forensic services. Mr. Cross can describe this very adeptly in detail, but it does help us get people to the right level of services and decriminalize some of the lower levels of criminal behavior mental illness behavior that becomes criminalized. In addition to these work programs, we're working on some other aspects. As I mentioned, Mr. Cross has accepted the position of statewide forensic programs coordinator. This is a step towards establishing an office of forensic services statewide that was recommended to us and will be a huge leap forward in modernizing our system. We're working to open the D-Pod at Ross and Neal Hospital for forensic services, and depending on single rooms or double rooms, that is 20 to 30 additional beds. And again, we can use those for 3 to 4 patients, for short-term patients a year. That staffing was approved in the last budget, and we are hiring those people currently. We continue to work on diversion programs and expanding the existing diversion programs and engaging individuals in the mental health system rather than getting them to the forensic system, such as the Ross and Neal misdemeanor diversion inpatient services. We're collaborating with Medicaid to ensure that behavioral health services are reimbursed in a manner that encourages their availability. So again, these services that could keep people from getting to this level of care in the community being available, reimbursed in a way that providers can continue to operate. And of course, this body approved the design of a new forensic facility. That design is underway and going to BOE in January, in keeping with the master plan for our southern campus. So we're happy to answer any specific questions that you might have. Thank you very much.
Thank you. And members, this is the second meeting that we've had this discussion. At the last meeting, we had absolutely nothing in writing. We have received a 3-page document that gives us a little bit more information. Maybe not as much detail as we were hoping to receive, but there is something. So Senator Neal, I apologize. If you are, can restate your question, I think this is the time to ask that, now that we've had the overview.
So, thank you, Madam Chair. I don't know how to start this. So can I start with this question? I remember that we had this conversation in October. We didn't move it forward because we needed that additional detail. There were very specific questions on the chart that was given to us on pharmacy, program supplies for the year, really breaking out how this money was going to be expended in an effective way, and trying to give us more insight into like the type and the scale in which these dollars would be expended. I didn't see that in a 3-page backup. Can you offer some information to the questions that we actually asked in that hearing in October?
Chair Monroe Moreno, through you to Senator Neal.
You can go directly to the member.
Thank you very much. Senator Neal, I very much appreciate the question. We did make adjustments based on your question about the medication specifically. We have additional programmatic detail available today in the sense that Mr. Cross can speak to this. Our overall goal with this jail-based programming is to ensure that the jails have the flexibility they need to run a program that they can run in their jail. So we're endeavoring not to dictate the exact expenditures, to give them, our goal is to give them that flexibility. And that is partially designed to make sure that those funds can be obligated, or at least that was my thinking, in a timely way. So, but would it be helpful to you if Mr. Cross were to describe the program that he's more familiar with?
Yes, it would be. Thank you.
Good afternoon. Drew Cross, Statewide Forensic Program Director, for the record. Madam Chair, through you to Senator Neal.
You can go directly to the member.
Thank you. Forensic services have experienced a 35% increase in orders in 2 years. So between 2020 and 2022, 155 additional commitments have been reserved for forensic patients in the state of Nevada. We currently have approximately 150 individuals awaiting inpatient forensic services. One part of the solution is jail-based programs. The design of this program allows earlier stabilization of psychiatric symptoms through medication management, specialized program, and monitoring. The goal is to facilitate access to robust mental health services for individuals who are awaiting competency evaluation or restoration services, or who have returned to the jail after completing competency restoration. In addition to providing more humane care to defendants, these enhanced mental health services can help decrease length of stay once individuals admit to a competency restoration program and prevent individuals from being re-referred for competency after restoration is completed. In the absence of a jail-based program, individuals often decompensate when returned to the jail and in some cases require readmission. Data from other states has shown in some cases that 50% of the clients who are involved with this type of treatment no longer require the forensic inpatient setting. The jail-based program is cost-effective, reducing the cost per bed by 50% compared to the inpatient forensic setting. For those treated in a jail-based program and their level of acuity still requires the inpatient setting, the program still shows benefit. Another state has illustrated that the length of stay is 57 days for those who have completed this type of program. And for this committee, it should be known that the length of stay in Nevada for fiscal year 22 was 111 days. So it is with collaboration with our community partners, including the Washoe Competency Court, that we have the support of. We think this program would benefit statewide everyone seeking forensic services. And if there's any questions.
Yeah. Madam Chair,
Go ahead.
can I ask yeah, thank you. So I appreciate that summary about other states. So let me ask you this. So if you look at the chart, because I want to get more detail on this anticipated personnel within Clark and Washoe for the proposal that you're thinking of. So you have, according to, well, for the county, it's proposed to have 15 medical providers, 9.4 correctional officers, and then in Washoe, 6.1 medical providers, and then 11 correctional officers. In the budget, you have for the 2-year total for Clark, roughly $5 million, and then you have your personnel in jail and then your personnel for program, right? So for the Clark County, it's roughly $6 million, and then for Washoe, it's roughly, I would say, almost $5 million. Can you talk about, I guess, this anticipated personnel and how they are supposed to really work and perform within this model that you're proposing? Because I think it's like I'm having deja vu. It's bringing me back to the same exact questions that I had about the high number of the amount of money being spent on the personnel versus the pharmacy and the program supplies and what we know to be the acute circumstances in which you're going to encounter. Also, the fact that I remember in the October hearing that there were direct statements about we don't really know what we're going to get, but we're trying to plan around what is potentially going to occur within the system. And you guys never actually provided like the level of acuity, the level of disease, mental disease that you may encounter. Like that information was never given so we could get an understanding if the appropriate ratios actually existed.
Thank you, Senator Neal. If I might clarify the question, you're asking about the staffing ratio on the unit in the jail that would serve as this program? Is that?
I mean, if you can break that down, you really just have a 2-year window and a dollar amount for what you need in terms of personnel, right? And the rest of the question just added in the information that I didn't know in October that I still don't really have clarity on right now. Like the acuity that you're dealing with, the type of individual that you're managing, and the level of humans that you need in order to run this program within the jail.
Thank you, Senator Neal. Cody Finney for the record. the medical personnel, the specific types of medical personnel, is that part of your question then?
Yeah, if you would like to provide any of the said or what you believe that you think I'm saying. I want more detail, right? This wasn't approved in October for a reason, right? And so I want more information on the human beings in which you are asking for this amount of money and what they're going to be performing and doing.
So Senator Neal, I can address the question regarding the population served. Sorry, this is Drew Cross for the record. This is going to be anybody who is dealing with a legal entanglement where competency is a question. So this is going to include both the pre-commit evaluation clients and those that are on the wait list for restoration for inpatient service. As far as acuity goes for this program, the locked maximum security forensic facility is still available for the highest acuity clients. We're not saying that every client is appropriate for this program, but the vast majority are. For those that require the maximum security setting, we still have the forensic inpatient setting available. But I did want to clarify that would be the primary population. Clinicians, trained clinicians with the background as forensic certified evaluators would be doing the screening to determine who enters this program. We would be willing to consult with our county partners to establish how that assessment is done. But that would, for the most part, address most of the population involved in this type of program.
Okay, thank you for that. So can I move and ask questions on L9 and L20, Chair, on the additional staff for Lake Crossing?
Before you move to that, I believe Senator Nguyen has a question on this section.
Okay.
Thank you. I know that there are representatives here. I see Chief Haas as well as Joanna Jacobs from Clark County. They might be able to answer questions on how this pilot program would be implemented. And so I may ask them to come up here to, because they might be directed to them. But I also know in talking with Washoe County, and I think Captain Barboza and Lieutenant Jim Cox might be in Carson City today. I don't know if that's the case.
They are.
They are. I don't know who can answer this, probably one from each. But some of the questions that I know my colleague, Senator Neal, was asking about what this program actually will look like. I mean, I saw the supporting documentation that you want to model it after that Miami program. Is there someone that can be willing to step up to the mic to kind of describe what this program would do and when it would, how it would, I mean, we understand generally that there's a population that is going to be addressed, but what are these positions and what do they do and where do they intervene and what kind of services are they providing? Is there someone that can answer those questions, like more specifically as they relate to in the jail?
If there's a representative from Clark County Detention Center that can answer that, I invite you to the table in Las Vegas. And if there's someone here in Carson City from Washoe County that can shed some light on that, I invite you to the table.
And I appreciate your indulgence, Chair. I know I had the opportunity to speak with both of these groups of individuals, and they were much more, I think they were able to articulate exactly what they planned on doing with this money and what the staff would be doing in the jails. Thank you.
Good evening. We'll go ahead and start here in Carson City.
Good afternoon. James Cox for the record, COX. I'm a detention services lieutenant. I'm currently assigned to our medical and mental health as a liaison. With those contracts, I think I can answer what we think the jail-based competency program will look like, at least initially, as we spin this up. Realistically, we're dealing with this population no matter what their acuity is. We are the first place where these individuals will come to, and we're responsible for their care and to be the custodians while they move through both the forensic competency process and the legal system. So we're already dealing with this population, and we have several mechanisms in which we do that. We have specific housing units that are there solely for the purpose of treatment of mental health. We have mental health providers that are currently working 40 hours a week. We're constantly updating and working with our partners with Lakes Crossing, with the bench, as far as the district court, to treat these individuals. What this proposal will do for us is currently our population, our mental health population is spread between 4 to 5 different housing units. And that would include those that are eligible for that initial competency and then the evaluation of competency. What we envision is us taking what we're doing, making a single housing unit, basically mirroring what Lakes does for competency, and start that programming, for instance, at the beginning and initially, and identifying that individual almost upon intake, rather than them waiting for pretrial hearings, initial arraignments, status hearings. We can start this treatment, the basic treatment, which will then identify the person sooner and get them possibly to diversion sooner. So the staffing levels, I believe, was the question from the senator in Las Vegas. For us, we have approximately 6 clinicians. I'm doing this off my memory now, and about approximately 10 commission staff. So the deputies will have the additional training, and why we're saying 10 instead of the 200 people that we have that work as deputies is any of those deputies can work in any housing unit assignment. The 10 will be forensically trained additionally on top of our training that we already conduct multiple times a year for mental health, to work within that programming. And they're going to have the additional knowledge to be working with that population, much like Lakes Crossing custody personnel have. And then working along with the mental health staff, so that because it's 24/7, whether the medical provider is there or not, custody staff must still be there and be able to follow the same processes. Again, mirroring ourselves in this particular housing unit that we'll be using this program for, on what Lakes Crossing has already been doing successfully for decades.
Thank you.
Thank you, Madam Chair, for allowing that. I know that we have Metro down here too, and I think they would like to chime in if that's possible.
I was going to ask them to go next.
Yes, thank you. For the record, Captain Zavzem, the South Tower captain, also oversee the medical contract at the Clark County Detention Center. Just for the record, 30% of our population is currently receiving mental health medication, 2,600 mental health provider and mid-level psychiatric visits per month that we do. We have 25 MHP positions currently at DSD with a $6 million dedicated budget to mental health needs. Mental health is DSD's largest expense after agency labor and medical services. When we put together the proposal, we were looking to add additional staff to be able to provide the programming that is needed in order to help shorten the amount of stay at forensic facilities. So we're looking at the additional staff so they can concentrate on that population in order to shorten the stay, because right now we have a waiting list just at CCDC of 113 as of Monday. So we're looking to help shorten the stay and give the services and work with the state on providing the continuum of care to where that they're getting it at an earlier stage in their incarceration. That way it shortens the stay, and hopefully if it works where if we eliminate that process, that is also a benefit as well. But at this point, we're looking just for the staffing aspect of it. We added the correctional staff because we have we provide CIT training to all of our officers, so they're well versed in dealing with the mentally ill individuals that are incarcerated in our facility. But in addition to helping the mental health providers provide that programming That way they're getting groups, individualized programming. That way they can potentially shorten the stay. So that's what we added, the additional mental health staffing. That way my other mental health providers can concentrate on the job that the great job that they already do with our current population, but then we can concentrate on this particular identified individuals. That way they can get the specialized training in order to shorten that gap and relieve the pressure that we currently are seeing with the extended lists.
And I have a question for both of you. This would be a transfer of ARPA dollars, and then once those dollars run out, have both agencies come up with a plan or thought about how to fund these positions after that? And then my second question on top of that, we always hear about hiring is difficult, and especially with anything in law enforcement. Do you think you'll be able to hire the corrections officers that you'll need in addition to the mental health professionals?
Good evening, Madam Chair. My name is Deputy Chief Fred Haas. I'm over the Detention Services Division with Metro. Our hiring program has been pretty robust this past year. We just started an academy with 88 people on the police side, and we're starting to increase that recruiting efforts on the corrections side as well. Right now, I run about an 8% vacancy. It'll go up a little higher towards the end of the year, and I hope to have that filled by June or July of next year. So I'm confident in our staff's ability and our HR's ability to get those right people hired and into the system that have a passion for doing this kind of work and helping people not only get out of the situation they're in, but help them get through the system as well. The staffing for me is pretty easy. We're large enough I can move around and make sure this gets staffed immediately.
And Madam Chair.
Madam Chair, this is I'm sorry. This is Joanna Jacob from Clark County. Excuse me. I'm sorry to interrupt my colleague from Washington, but I just wanted to address the second part of your question, Chair Monroe Moreno. We listened to the discussion today with great interest, and I think that the issue about these are funded with ARPA dollars. This is why we originally partnered with the state to have the money come through Clark County. Clark County's role in this, just so for edification of the community, or for the committee, excuse me, it's been a long day too, is that we fund detention centers, so the money is going to come to us, and we're partnering with Metro, and they will do the operations of the program. We have partnered with these gentlemen sitting with me at the table quite successfully on a number of programs supported by our board, and it would just be a matter, Madam Chair, as we get closer to the end of the pilot, if it's something we would work on with the state and with Metro to assess future needs. So I don't have an answer for you today, but we have a record of successfully partnering with Metro on services in our jail, and it would be evaluating that for a future budget.
Thank you.
And Madam Chair, James Cox, representative for Washoe County Sheriff's Office. A couple parts to the question. The staffing part of it is we've already identified our staff that would be going into that unit preliminarily. We too have been part of CIT. I actually started that around 2005 or so. So all of ours are trained CIT, but we're going to be getting through the state in partnership with the state additional training for the what I'm calling the forensic component to this. So those deputies have already been identified. The sheriff is very proud in the fact that in his 5 years, he has been very committed to getting us to fully staffed, and we are currently fully staffed. So we're using already commissioned deputies for this unit immediately, so we don't have that training lag, and then we'll be backfilling with these funds to take the place of from the position of the line. And if you could help me, if you could remind me on the second part of the question.
It was once the ARPA dollars do not exist, have you thought about how to fund those positions moving forward?
Thank you for jogging my memory. James Cox for the record. So Washoe County and as a whole is also very committed to this relationship. I know that the sheriff has spoken to me, and the general plan is to assume these positions at the end of this funding. That's his preliminary idea. Now, there's different funding issues that could be coming along, and so that's just the general concept at this time, because we see this as a multifaceted component to what we're doing to address mental health. Washoe County has already assisted us by starting to contract with our current provider for those initial evaluations. So this is yet another component that Washoe County as a whole is committed to providing and funding for and continuing on.
Did you want to add anything?
Thank you, Madam Chair. For the record, Cadence Matievich. I'll be brief, just to follow up very similarly to what Ms. Jacobs said earlier, and to follow up from my comments this morning. The Washoe County Board of County Commissioners has prioritized looking at behavioral health in Washoe County as one of our primary strategic priorities for the upcoming year. That behavioral health administrator position that I spoke of this morning, focusing on programs like this and others, will be one of their key tasks when they get hired. We're looking at bringing them in early in the year. So we will be exploring ways to fund those long-term, but the representative from the Sheriff's Office is correct. We are absolutely committed to this. We are very optimistic that this pilot program is going to show significant benefit, and we will invest dollars when that comes to fruition. Thank you.
Thank you. Is there anyone else that has any questions on L1, L2? And Senator Nguyen, did you get all your questions in that you had?
I believe Assemblywoman Gonzalez has a question. But I did get my questions
go ahead.
answered.
Thank you so much. I was curious what the conversations have been like with the public defenders, district attorneys, and courts, and are they in support of this? Thank you.
Thank you. For the record, Joanna Jacob on behalf of Clark County. I can answer the question with respect to our public defender, because it is county department. So I did speak with our public defender, Darren Inlay, and he did authorize me to put on the record that he's in support of this proposal and the proposals that are before you. His position, on the position that he authorized me to say, is that there's a lot of work, as this committee knows, that we have to do on mental health services in this state. But from his perspective, this is a good step forward, and that this is something that anything that we can do to reduce this backlog is something that he supports. I did speak with my colleague at the district attorney's office today, but they haven't yet. We are. The next steps on this is, if the money should be approved today, is that we would then go back home and we would bring everybody to the fold. I want everybody to understand that this is a population detention center is seen anyway. So as we need to bring in the other criminal justice partners, such as the courts or the district attorney, we intend to do so.
Assemblywoman Gonzalez, did you have any follow-up?
No, thank you.
Perfect.
Madam Chair, for the record,
Go ahead.
James Cox, just to kind of emulate in what we're doing up here in the north with the Washoe County Sheriff's Office, I can tell you right now that Chief Deputy Solferino, who is in my command, in my direct chain of command, and has been before this body before, is currently with our public defenders, a judge from the district court, and several other people that are very involved with these projects, and they are currently just flew this morning to Miami to look at some of these additional programs so we can continue to get some innovative ideas as to how we can continue to create success. I also yesterday had a meeting with Captain Barboza, who's behind me, and Judge Egan Walker with our district court, the Second Judicial District Court, where he has committed his time and is taking over much of these competency hearings, and he's actually performing those through Zoom at our jail and the public defenders are coming to our jail for these hearings, and this has been happening for approximately 8 weeks now, and is happening every Thursday. So our judicial community, our legal community, with the Washoe County District Attorney's Office, Chris Hicks, and his representative, Zach Young, are very committed to working together to solving this problem holistically rather than individually.
That's great news. That's good to hear. All right, I don't see any other questions for L1 and 2. We can move on. I believe Senator Neal had questions from other items on list L, correct?
Yes, Madam Chair, was on the renovation and operation of the vacant forensic buildings.
Go ahead.
Okay, so the question I had around the buildings is, what is the agency's current vacancy rate associated with, well, the current vacancy rate, and does it have any concerns about hiring any additional clinical staff, both contract and state positions, to provide expanded services if you go in and rehab these vacant buildings or renovate?
Drew Cross for the record. The current vacancy rate at Lakes Crossing is approximately 18%, which is a notable improvement. And SNAM's Southern Nevada Adult Mental Health mirrors that vacancy rate at 18%. With the additional contract staff we've recently hired at Lakes Crossing, the clinicians, the individuals who are tasked with doing the evaluations and assessments, the current vacancy rate is 4%. So we've had some tremendous success recently.
Cody Finney for the record, if I might just add, we are seeing anecdotally a increase in applications for state positions as well, since this body approved additional funding for our salaries. So that I'd just like to express my gratitude for that, because it's much appreciated. And if I might just indulge, I really appreciate Clark County and Metro coming to support us and spending their day during a very difficult time. And extremely grateful to Washoe County as well. So thank you for that. Thank you for that. And so I have another question about the renovation of the vacant building 3A. So you're asking for funds, or there is money for you to go and renovate that building, but it seems like it has a lot of work yet to be done to that building. Can you elaborate on that a little bit?
This is Susan Lynch for the record, Hospital Administrator for Southern Nevada Adult Mental Health Services. We have been working in conjunction both with Public Works and with HCQC to develop the full list of all the renovations that are needed for Building 3A. I won't go through one by one, but I can kind of summarize some of the main issues that we're seeing in that building. Three of the things that are of need of updating and renovations are the HVAC system needs to be updated, as well as there's aging wood structures on the property, most closely in the courtyard area, that needs to be removed. There's additionally repairs needed to both the roof and the windows need to be replaced as well. Additionally, we're requesting funding to upgrade the anti-ligature features of the building. That's both in the patient care areas and in the common areas as well. Those anti-ligature upgrades include furniture, bathroom fixtures, the door hardware. Additionally, we are asking for funding to upgrade the camera system, and then also some parts of the fire protection system, such as the sprinklers and the fire alarm system.
Thank you for that. So for the renovation of that building, in my notes, it's roughly $8 million for FY 2024, and then the agency believes that there may be an additional $6.7 million in ARPA that would be requested in FY 2026. And I guess, I mean, with this recent information that I guess we learned,
Do you think, number one, that's going to be enough money? Do you think that waiting on that allocation for 2026 for the 6.7 million for ARPA is actually going to be feasible? It seems like there's a lot wrong with this building to make it functional.
Thank you for the question. This is Susan Lynch for the record. Our plan was to time it according to the extent of the renovations needed, so that was why they were two separate work programs at two separate fiscal years. So we feel confident that the 7.94 million for the the 7.95 million for the renovations is adequate. Obviously, at this point, we'll have to reevaluate the request for our operating costs and the staffing accordingly. But I think, like both Ms. Finney and Mr. Cross said earlier, we have been actively recruiting for positions, both contract and state positions, ongoing for years now for these positions. So we're just incorporating, filling all the holes in our agency as we can with those ongoing recruitment efforts.
Thank you for that. And then my final question, Chair, is, so in regards to the funding sources, have you considered for continuing staff and operations, basically how you will fund that in the later years?
Yes, thank you for the question. Susan Lynch for the record. Most likely we'll have to build that into the Southern Nevada Adult Mental Health Services budget with requests to this body for increases from the general fund.
Okay, thank you for that. Thanks, Madam Chair.
Thank you. Members, do you have any other questions? Well, in light of the conversation that we had with the GFO about the dollars, or lack thereof, moving on, I believe that safely we could approve L1 and L2, which would be the coordination of the Clark and Washoe counties jail-based programming for the forensic clients. L19 and 20, if I understand it correctly, and the GFO is here, she can correct me. Those would be contracted staff, and as long as we enter into a contract, we are within the Treasury's guidelines for obligated funds, so we would be safe in doing that. L21 and 22, we know we need the building renovated, and having the funds to do that, we could approve. However, L17 and L18, with those 83 FTs, we would need to defer until we have a better understanding of how we would fund those. That make sense?
Cody Finney for the record. It does make sense to me. It's my understanding that the dollars for 17 and 18 were to be placed in a special use category to be moved to Cat 1. We could instead move those to a contract category if that solves the problem, but makes sense to figure that out now that we have this additional information.
And I think with that, the additional information that we received today, when we come back in February, we'll have a better idea if we can move forward with those two items. I didn't see you move to the table. Good evening. Members, does that make sense? Any questions? Down in Las Vegas, does that make sense? Does anyone have any questions? All right, I am not seeing any, so with that, I'll accept a motion.
Thank you, Madam Chair. I would move to approve items L1 and L2, L19 and L20, and L21 and 22. And I would, yes, so we'll start with that as a motion to approve those items, Madam Chair.
Back a second.
We have a motion and a second. Any discussion on the motion? Not seeing any. All in favor, please say aye. Aye. Any opposed? The motion carries. And then the second part of the motion.
Thank you, Madam Chair. I would move to deny items L17 and L18 in light of the additional information we've received regarding the usage of these funds for staffing beyond the 2024 December deadline, and with direction to the agency to bring this item back if we can find a way to pay for those with these funds.
Second, Backus.
We have a motion and a second. Any discussion on the motion? Not seeing any. All in favor, please say aye. Any opposed? The motion carries. Thank you so much. I appreciate the discussion. I know it was long, but it's very important. Next item on our agenda is L3, the Division of Human Resource Management. Good evening.
Good evening. Matthew Tuma, Deputy Director for the Department of Administration. DHRM is a division within our department. This is a request of an addition of $1 million in ARPA funding to the DHRM budget to support contract services to assist state agencies in the recruitment and hiring of employees. This is the continuation and the expansion of a pilot program that has been pursued over the last few months with the Department of Corrections that we've had some wonderful successes here, and I have Deputy Director Shea with me from the Department of Corrections to kind of walk through that pilot and why we have some good success that we want to roll out a little bit more broadly.
Thank you, Deputy Director Tuma. Deputy Director Shea, Nevada Department of Corrections. Good evening, Madam Chair, members of the committee. I'll make this brief, just because I know we've been here for a long time. So the department's currently sitting at a 33% vacancy rate for our correctional officers, and we made a commitment to this legislative body during the legislative session to make sure Dr. Zorinda and I, put top priority in recruitment of correctional officers into our institutions. I'm happy to support through a pilot program that we did for the last 3 months that we're seeing an uptick in our hiring processes from legislative session in February. We've hired roughly 80 correctional officers in retainment. And not only that, by partnering with All-Star talent recruitment, we have roughly 5,314 leads, 3,000 that have passed pre-screen, 555 apps that have gone into NV apps, and 392 leads that actually are available for us to recruit, with an uptick of roughly 30% in our academies. So with the success, we met with DHRM and the Governor's Finance Office, and we really want to extend this more broadly to include our medical staff, our mental health staff, and really try to address this as a global statewide initiative. So with that, we're available for any questions.
We have a number of questions, and I will start with Speaker Yeager.
Thank you so much, Madam Chair. In looking at the backup documentation for this item, I was, I guess, disappointed that it seems like some of the policies that were enacted in Senate Bill 431 that would transfer some of these processes to the agencies are not working, because the volume of work associated with evaluating candidates and managing recruitment is a lot for the agencies to take on. So I guess before I get to the questions about the $1 million, which I understand would be targeted to law enforcement and healthcare positions, I just wondered if you could give us a little bit more of a sense of, are there other agencies in particular beyond law enforcement and healthcare that are experiencing difficulties in the enactment of Senate Bill 431, and how utilizing the vendors as envisioned here would help if it were to be expanded beyond those two areas.
Matthew Tuma, Deputy Director for the Department of Administration. Thank you very much for the question, Mr. Speaker. Yes, I think we have a number of things going on, and as you all know, HR management issues, HR practices, and our fundamental governing statutes had a lot of discussion in the most recent session, and a lot of changes that were partially, that we're in the process of implementing as we go forward. And so as we do that, identifying what staffing support needs at agencies are is something that's going to be an ongoing evaluation, as well as what structure within DHRM for the staff support from DHRM is going to be very important as we evaluate that and are back in front of this committee and back in front of the next legislature on asking for any of those ongoing costs and structural changes. I'd say this contract in particular, the funding that we expect for contract services under this allocation is very different from what we have typically relied on state staff, either at the agency or at the DHRM level to do, in the sense that we've generally been reactive on a staff level of when we open a position, we expect people to find that position, and we expect people to apply for that position and to go through those evaluations and have a higher demand of potential applicants for every position that's available than what we have availability for. The vacancies that we've experienced really that have been accelerated post-COVID have put us in a situation where we're playing catch up and being in that reactive function for what we have to do with things on the process side has meant that we haven't had enough applicants or qualified applicants to go through that process and fill all of those positions. So this contract is specifically, or this funding is specifically for contract expenses on being proactive about getting applicants into and funneling them into the state system that we can evaluate their applications, evaluate their credentials, help them get beyond any of the internal hurdles that we have as far as evaluating people, what we need to do in being able to place them in positions. We have quite a few barriers in place. Some of them are being handled from a technological aspect as we move forward with the OPM project and the systems that we use that people can upload their resumes and get into it. But it's also about just sort of being a little more proactive and finding candidates that might be interested in working for the state of Nevada and making sure that we're reaching out to them and teeing them up and lining them up into positions that in the past we've just relied on them finding naturally on their own and using state staff to just evaluate the candidates once they have already submitted their application and processing it from that end. So I think I answered your question, Mr. Speaker, but let me know if you need me to add anything additional there.
Thank you so much. And Madam Chair, if I could just ask one follow-up question, please.
Go ahead.
You did a pretty good job of explaining, the proactive nature of what the $1 million here would be used for. And so I guess, in looking at the backup documentation, it looks like the real gist of this is to use social media to sort of target individuals, to generate leads, potentially to generate applications. And then I guess my take on it is it would be handled by the agency from that point on, that it's not the vendor who's doing the actual, interviewing and that sort of thing. So I guess the second question I have there is how are you going to evaluate this contract in terms of success at the end of it? Is it going to be evaluated based on the number of leads, based on the number of applications, based on who gets hired? Like, what metrics will you use to evaluate this to determine whether this kind of program should be extended in the law enforcement and healthcare positions, or whether we might extend it beyond to other positions that are in need on the state?
Matthew Tuma, Deputy Director for Department of Administration, and I think all of those metrics that you listed would be things that we would be judging the success of this on. Those are where we've found some success with the pilot program, because one of the natures of working with contracting a company like we've done under the pilot with All-Star is that they've been able to produce quantifiable data and individual information for people at all stages of a potential lead development, and just sort of a cursory instance, and as well as tracking in what process they might have dropped off or moved forward into actually being placed and hired into a job in the state. And so we would look at the success at A to Z of getting people that have been identified through these contracts and getting them actually placed into the jobs, and widening our pool of qualified applicants that we can fill jobs with.
Thank you so much for that response. Thank you, Madam Chair. I have no further questions on this agenda item.
Thank you. I just have one question. So with the changes that were made in 431 and having the agencies do pretty much the HR job, this is one-time funding for this vendor contract. Once that runs out, will the agencies, at some point, will they be trained on how to do this themselves? What's the future look like moving forward? Are we going to continue with the contract with a vendor, which kind of seems counterproductive of what the bill said it was going to do? Or are we going to train the agencies to actually do the job of recruiting and hiring?
Matthew Tuma, Deputy Director for the Department of Administration. So I don't think that there are any sort of silver bullets to solve all of our problems with recruitment and getting, filling our vacant positions and keeping folks in staff. I think it's a series of efforts. I know in the previous item, DHHS was saying thank you for the substantive COLAs that were authorized in the most recent legislation, or in the most recent legislature. That's one aspect. Compensation, recruitment is one. How we sort of train our folks through the hiring process is going to be an ongoing challenge. I know that there were separate pots of money for both the training and education components to roll out during this interim, a separate appropriation, as well as a separate appropriation for a more comprehensive class and compensation study. As we also look at rolling out the Core NV project and the successor of OPM, it's going to be about updating our actual tools and our actual interfaces, our application systems that people are going to be utilizing, and having a modern system that can do an automatic resume upload. So there's going to be some technological instruments that are going to be put into place over the coming years, in addition to how workflows and work responsibilities are going to be between DHRM and between individual agencies' HR staffs. But I think, you know, this is one-shot funding to pursue contract support where we know we have vacancies right now, and to get more people in line, and ideally sort of fill up some of the hole that we currently have with our large vacancies at the state, and figure out which things are successful, which things organizationally we're going to be having to implement on the DHRM organizational structure during the interim, as well as what we go into the next session and choose to fund as an ongoing basis, either through appropriations or through DHRM's normal internal service fund revenue and cost allocation. So it's an ongoing conversation about which things we want to continue to implement, as well as something that we're going to be doing on an ongoing basis as we update the regulatory structure that governs HR practices to conform with the statutory changes that happened in 431. But it's a lot of things moving at once at the same time as we're trying to fill a lot of vacancies. And so, again, we're not going to find one thing that solves all of these problems, but having some continuous effort of where things are successful. And that's where, for this particular funding source and this particular strategy, it's around the success that we've had in the pilot over the last few months, specifically around corrections workers, and funneling people into the state and trying to accelerate that and, yeah, fill that hole a little bit right now.
All right, thank you. Members, any questions? On L3, not seeing any other questions here in Carson City. Are there any other questions in Las Vegas? Not seeing any. All right, with that, I'll accept a motion.
Thank you, Madam Chair. I would move to approve item number L3 for the allocation of these funds for the contract vendors.
And Madam Chair, I'd second that motion.
We have a motion and a second. Any discussion on the motion? Not seeing any. All in favor, please say aye. Those are very low ayes. Any in opposition? Seeing none, the motion passes. Thank you so much. That takes us to M. M5 was withdrawn. And we'll go to M7. And we will hear M7 with M56. Good evening. You can go ahead.
Good morning. My name is Celeste Arnold. Excuse me, good evening. Sorry, it's been a very long day. My name is Celeste Arnold. I'm the Administrative Services Officer 3 for the Student Investment Division for the Department of Education. I oversee the fiscal unit. We currently have proposed before you the work program that we would receive funds from DETR in support of one of our programs.
Nice and short. You are tired, and I so apologize. I know we have a few questions, but before we get to the questions, Dieter, did you have anything you wanted to present on this?
For the record, Christopher Sewell, Director of DETR. No, we are sort of the money people on this one. So if there's any questions about the money and that aspect, we're happy to answer any questions.
For the record, Celeste Arnold. Down in Las Vegas, I do have my program director, Jeff Brisky, who can also help answer questions.
Perfect. Did he have a presentation or just help with questions?
Help with questions.
Perfect. Then we'll go right to questions. And I believe I have Senator Nguyen that has a few questions.
I do have a couple questions, Chair, if that's okay. I'm not sure who this would be directed to, so I'll just direct it into the ethers here. Please confirm how many educator candidates the Nevada Department of Education would support in fiscal year 2024 if this work program is approved, if you know.
Good evening, Jeff Brisky, NDE for the record, Director of Licensure, Educator Development and Family Engagement at the Department of Education. For this particular grant called Incentivizing Pathways to Teaching, approximately $7.8 million was requested from our ed prep institutions for these funds, which represents exactly 1,316 students who are in their final semesters of their program, many of which will be student teaching in the spring.
Thank you, and this is kind of related. Since 1.1 million of that transfer is just one-time funding in fiscal year 2024, how is the agency going to address those funding requests from the universities and colleges going into fiscal year 25?
Jeff Brisky, NDE for the record. As you know, 6.7 was allocated for 24, and due to the shortfall, DETR did give us $1.1 million generously. For the 2025 fiscal year, those applications typically go out to our ed prep institutions in the early spring, February, and then the state board will make those allocations based on available funding in March or April.
And so what's the change of that available funding do you anticipate from fiscal year 24 to 25?
I can't answer that honestly because we don't know how many requests will be coming in. If they do remain the same as they were in 24, we will be short about 1.1 million again.
And thank you, Madam Chair. That's all the questions I have today.
Thank you. I know that Assemblywoman Anderson has a question. And then I have a question if she doesn't ask what I'm thinking of.
Thank you. Thank you for the information, and thank you also for trying to do something about our educator pipeline. How has this been advertised and or recruited? I realize that's not going to be from Mr. Sewell's department, but how do people know that this is in fact in place for them to be able to apply for it?
Thank you, Jeff Brisky, NDE, for the record. For this particular grant, these students are already enrolled, and again, they're in their final semesters or student teaching. They have already been identified. So this money, according to our ed prep institutions, has already been allocated to those specific students who are at the cusp of finishing their program and will be in the classroom this fall.
And so I just want to ask a really quick follow-up that with that, with this grant, is there an expectation for them to stay in the county and or state where they are receiving these funds, or is it, hey, congrats, and then they get to go to California, Oregon, Washington, other areas? Because we know that many states are facing the same issues we are when it comes to educator retention.
Thank you for the question, Jeff Brisky, NDE, for the record. If my memory serves me right, according to AB 515, the students are supposed to stay in Nevada and teach for 5 years, I believe, and I may be wrong on that, but I think it was an AB 515.
Thank you so much, and great memory. Thank you, Chair.
Thank you. And it may be in my backup, but could you just let us know what is the stipend that those students are currently receiving? The amount.
Sure, Jeff Brisky, NDE, for the record. For our federal funds that did conclude this past September, the department decided that the tuition amount would be $2,000, up to $2,000 per student for tuition and up to $8,400 per student per stipend. However, for the state funding in AB 515, there was no limits or minimum for either the stipend or the tuition. So we did leave that up to the ed prep institutions who do know the students best, their financial aid needs, and when they will hit their federal cost of attendance. So each student is unique in their needs, and we left it up to the ed prep institutions to make that decision.
So I have a question. Has there been any thought put to, since the money that we're talking about is for FY24, and there would be a drop-off and could be a hole for FY25, and you'd have to find funding. Instead, has there been any thought to just separating the money for equal amounts for each year so there would not be a drop-off, just that set amount of money for FY24 and FY25?
The department has not entered into those discussions or suggestions to the state board who makes that decision for allocating the funds. What the department does is we look at what is available to us, and then we make those recommendations to the state board, who can then decide how they do want to spend the money.
Are there any prohibitions to using the wage assessment money for this?
I'm going to defer to my friend in the north for that.
I'm Celeste Arnold for the record. I'm sorry.
That would be a question more for Dieter, I believe.
For the record, Chris Sewell, Director of Dieter. Let me sort of step back a little bit and sort of tell you how this actually got started. I was in a meeting with President Hilgersom of Truckee Meadows Community College, and we were discussing, how we could help, our youth. And one of the things we ended up talking about was her son was going through the last semester of becoming a teacher. And she goes, I've heard a lot of stories about people just stopping and not finishing their degree because they have to raise a family. And so I said, we're going to see if we can figure something out. So we used SEP money, Career Enhancement Program money, for this. And I am married to a kindergarten teacher, and she told me that, yes, it's very true. We have people that are, yes, we have young people that are that want to go right into the education field, and parents help. This isn't for them. This is for the people that are coming back into maybe a second career, or maybe we're in the military, or some other job, and they want to become a teacher, but they also have to raise a family, pay mortgages or rent, car payments. And so that's where this sort of started. So I was able to get Career Enhancement Program money together to help fund this. If I can do that again in '25, I will. I'm going to be very transparent with this body. I've always been transparent with this body. And if I'm going to, if I have $1 million, I'm going to put it in. If I have $1.5 million, I'm going to put it in. Because teachers, we need teachers. Desperately, we need teachers. And I hear it every day. And so that's where this funding came from. And if we can do it again, we're going to do it again.
No, I definitely agree with you. As a mother and aunt of educators and the wife of an educator, I definitely know it firsthand. My question, the reason I asked that is so there'd be a little bit more stability for those students, so they know that there would be funding in '24, and they wouldn't be wondering, will I have the funding for '25? So having something a little bit more stable for those students.
For the record, Troy Jordan, Deputy Director of Programs for Dieter. To try to ease the committee's mind, SEP money comes in every year quarterly. It comes in with the unemployment taxes. It's the most flexible money we can give out. I'll knock on wood, I would be willing to project that this level of funding would be there, no doubt, in '25, and we could actually earmark money in April to fund '25 if we needed to, if it was that robust. But SEP money is normally readily available, and there is no restriction that would be offended by this particular program. It's very flexible funding.
Perfect. Thank you for that. Senator Spearman.
Thank you, Madam Chair. So you mentioned, Dee, you just mentioned that you mentioned 2 or 3 different categories, and you said in the military. So tell me how you all are partnering with the military, because for the education benefits, it also includes a housing stipend with the Yellow Ribbon program.
I was just using that as an example of someone that is coming in, that had a job, and the military is a job. And once they're released, I was using that as an example of someone that wanted to get into education. They were doing something else and they wanted to get into education. So that's the example I was using. I misspoke.
Yeah. Follow-up, Madam Chair? Yeah, so if you misspoke, that might be an opportunity to take a look at what the military does offer, VA benefits, and you might want to look at the Veterans Commission to check that out, because I know that, as I said before, when you do the education benefits, for about the last 10 years now, they've offered also housing. And so that may be a way, because I know they have, the helmets to classroom programs and things of that nature. So you may just want to check with them, because that would probably help you out exponentially, and it would not add any expenses to the budget.
For the record, Chris Sewell, Director of Dieter, I love braided funding. I think if we can braid funding, the more braided funding we can do, the better off we are. And my Human Resources Director is Brian O'Callahan, who's the grandson of our former governor. And he came in through the military, and he's been an absolute godsend for Dieter and the state of Nevada. And so he knows all about those programs, and I'm going to definitely ask him tonight, because he is up here working in Carson City this week. Thank you, Senator.
Thank you. Members, any other questions here in Carson City? Not seeing any. Are there any other questions in Las Vegas? Not seeing any. So with that, I'll accept a motion.
I'd like to make a motion to approve the request.
Second.
We have a motion to approve, and it's been seconded. Any discussion on the motion? Not seeing any down south? Yep, north. Is there any down south? None. Okay, all in favor of the
Madam
motion?
Chair, Madam Chair,
ahead.
if I just may, and I would just like to make sure that in the February meeting, there's some type of follow-up with respect to partnering with the VA for the people who are going into education.
For the record, Chris Sewell, Director of DETR, yes, I will get something to the committee.
Thank you so much. All right, with that, all in favor of the motion to approve, please say aye. Any, any opposed? Motion carries. Thank you all. Good night. Now on to the next item on our agenda, which is item N, the statement of our disaster relief account balance. And we will ask Ms. Kaufman to present the balance.
Thank you, Madam Chair. For the record, Sarah Kaufman, Legislative Council Bureau Fiscal Analysis Division. The statement of the disaster relief account can be found on page 47 of volume 6 in your packets. I would note, however, that the amount that is being requested was revised by the Board of Examiners yesterday when they met. And so the amount may be a little bit different. So the current disaster relief account balance as of November 27, 2023 was $10,942,714. The Office of the Military Emergency Response and Management, the Office of the Military is requesting originally requested $20,537. However, the Board of Examiners revised that amount yesterday to $19,562. And this is to address weather emergencies that were that took place in March and August of 2023. If the committee approves the request, the balance after the December 13, 2023 meeting would be $10,923,152. Thank you.
Thank you so much, Ms. Kaufman. Members, that was an informational item only. Did anyone have any questions for Ms. Kaufman? All right, not seeing any. Then we will move on to item O on our agenda. It's a request for approval for a grant from the disaster relief account, and that is the Office of the Military. Good evening.
Good evening, committee members. Jared Franco, CFO for the Division of Emergency Management and Homeland Security for the record. I am accompanied by our fairly new Deputy Administrator who is attending her first ever IFC today, and she picked a great one to attend. We are here to request
I am so sorry for you. I'm so sorry. They're normally not like this, I promise.
It's been great.
We are here to request a grant out of the disaster relief account in the amount of $19,562 to pay for expenditures occurred during the spring thaw event and hurricane events that Nevada experienced this year. We appreciate your consideration and we'll entertain any questions.
Thank you so much. Members, any questions? Not seeing any here in Carson City. Is there anyone in Las Vegas that have any questions on this agenda item? Not seeing any. I'll accept a motion.
So move, Madam Chair, to approve item O.
Second, Madam Chair.
Thank you. We have a motion to approve. It's been seconded. Any discussion on the motion? Not seeing any. And the motion was originally for $20,537,000. Because of the actions at the Board of Examiners, they approved the amount of $19,562. So that is the amount that we would be voting on. All right. Seeing no discussion on the motion, all in favor, please say aye. Aye. Any opposed? The motion carries. Thank you so much. And I hope the next meeting you attend for your second meeting will be a little shorter and end during daylight hours. But happy holidays. All right, with that, going on to P1, 2, and 3, and 4 were all withdrawn. And Q was withdrawn. So we have up to R, the Department of Administration, State Public Works. Good evening.
Good evening. I finally figured out that you guys save the best for last.
Yes, we do.
Thank you, Madam Chair and members of the committee. This request is to increase the authority to receive and expend funding for materials due to materials costs on 21M30, which is the housing unit at NNCC, Northern Nevada Correctional Center, and receiving those funds from projects that are completed, 21M28 and 21M56, for a total of $1.2 million. I'd be happy to take any questions.
Thank you so much. Members, any questions about this agenda item R? Not seeing any here in Carson City. You know what? Being at the end of the agenda is so much easier. Everyone's like wiped out. Any questions down in Las Vegas? All right, not seeing any, then I'll accept a motion to approve. I have a motion from Senator Spearman. A second?
Second.
A second from Assemblywoman Bacchus. Any discussion on the motion? Not seeing any. All in favor, please say aye. Aye. Any opposed? Motion carries. Thank you so much, and happy holidays to you as well. Thank you. The next item on our agenda is item S, and it's information only. It's the Department of Business and Industry. It's the update of our housing division. Good evening.
Good evening, Madam Chair, members of the committee. And yes, I love being at the end of an agenda. For the record, my name is Christine Hess, and I am the CFO of the Nevada Housing Division. Administrator Acroft does send his regrets that he was not able to stay. He had a commitment that he was unable to move. I'm here today per the agenda item to give our every meeting update of the Home Means Nevada initiative. We did provide an updated spreadsheet as of December 7th. I'm not sure if the committee received that or not. We provided it last week. As of December 7th. That's the one I'll speak to, and if not, I can send it out again. Okay, great. Thank you so much. So the Home Means Nevada initiative, of course, was an award of $500 million for affordable housing that is being administered by the Nevada Housing Division. As of December 7th, we have obligated, which has been a big topic this evening, $277 million to 31 projects, which is about 56.5% of the allocation. We have spent $51 million, or 10.4% of the funding of the $500 million. We do anticipate a number of the projects being finalized in the next couple of months and obligated. And with that, I just want to highlight a few of the significant expenditures for you. If you'll note on the first page there, the second line item, Ridge at Sun Valley, this was actually the very first grant agreement that was signed. It was signed last January, and they currently are 76.4% spent of their award of $28.5 million. That's an affordable housing project in Sun Valley up here up north. And you can see that project moving. Next, if you go to Pinion, this project closed in October, and they're about halfway down the first page, another new development, affordable housing project up north. This project was awarded and obligated $13.6 million, and they have spent 56% of their funds. If you turn to the next, actually 2 pages, so the third page, let's see, yes, third page. The very first line of the home ownership, I also wanted to draw attention to this. This is the Nevada Housing Division's home ownership program that is was started with the ARPA funds. It's called Home First, and we awarded $7.5 million to this program. As of December 7th, the program has spent 46% of the funds. And just as an update and to kind of give you an idea how the spending can start slowly and then kind of starts to roll, we do anticipate running through the rest of these funds for the home ownership program by March. So we anticipate that many reservations for home loans with this down payment assistance. We were listening in the audience and heard very clearly the opportunity to support GFO, and we do work very closely with GFO and their team and are actually actively providing updated spend reports now. I'm just receiving them now from my subrecipient and passing them to the GFO team, but we will be sure to support GFO and meet the January 8th deadline so that they can meet your deadline. And with that, I kept it short and sweet and here to take any questions.
Thank you so much. Members, this is an information-only item, but do you have any questions on the document before you or the presentation? Not seeing any questions here in Carson City. Do we have any questions in Las Vegas? Not seeing any in Las Vegas. Thank you so much. We
Yes.
appreciate it.
Thank
Good
you. Happy
evening and
holidays all.
Happy holidays, yes. Well, that takes us up to the next item on our agenda, another informational item, and that's item T. And one second. We have T12B, if I remember correctly. TA2. 9A2.
Good evening, Madam Chair. Stacy Weeks for the record, Division of Healthcare Financing and Policy, also known as Nevada Medicaid. I have with me tonight, or this evening, Deputy Melinda Southard and Chief Michael Gordon here with me tonight. I'm happy to provide an update to members if that's what you would like. Okay.
Yes,
Thank
please.
you. Sorry, I'm a little tired. Stacy Weeks for the record.
We all are.
Okay, yes. I know. The division has been actively working with its vendors, stakeholders, and agency partners at the Nevada Department of Insurance and Nevada Health Link to meet the statutory deadline of January 1, 2024 for submitting the state's 1332 waiver application to CMS, which is required as part of Senate Bill 420. We have also been meeting at least weekly with CMS partners to prepare for the waiver submission, as well as our vendors. At this time, the division is on track to meet this deadline. The draft of the waiver has been posted to our website for public review and comment. The federally required 30-day public comment period will end on December 20th, 23. As of date, we have hosted 2 public comment meetings with the general public, one on November 27th in Carson City and one on December 5th in Las Vegas. Both had in-person and virtual options. Everyone, though, attended, except in one, I think we had a couple people, but most attended virtually. We also held 2 additional tribal meetings to obtain feedback on the application. We have received 20 written public comments thus far, with multiple live public comments during these meetings. There were 84 attendees at the first hearing and 90 at the second. We will be summarizing these comments over the coming weeks and making last-minute adjustments as necessary to our waiver application, as feasible to meet our deadline. This summary will be posted online with our final draft of the application, all of which will be submitted to CMS no later than January 1, 2024. A key requirement of this waiver application includes an independent actuarial analysis as required by federal and state law. This analysis must analyze for federal law various impacts on access, affordability, coverage, and the federal deficit, and make a determination of whether the reforms Nevada proposes will meet the requirements for federal approval. Milliman, our hired actuary for the waiver, has found that the waiver application does meet these requirements for federal approval, and has determined that the state would receive an estimated funding in $279 million to $310 million in the first 5 years, and then $760 million to $844 million at the end of the first 10 years. This federal savings is a direct result of 2 things: the premium reduction target that was set forth in Senate Bill 420 for the new state contracted health plans, which will be required to meet that target starting January 1, 2026. The other other item that's making up this savings is the new reinsurance program that the governor is proposing, which will begin in year 2 of the waiver program. And just to note, the waiver is a 10-year waiver program, and that's required by federal law. This savings is because with the lower premium rates in the individual market, as a result of these 2 reforms, the federal government will save the amount it has to spend on Nevada in our health exchange and buying down premiums to meet certain affordability levels for consumers. This savings is what we will capture under the waiver, if approved. The analysis also found that the governor's reinsurance program will help reduce the impact of the premium reduction target on providers and carriers by about half. It also found that this impact would be further minimized by the fact that the individual market makes up less than 5% of provider revenue in the state for most of the providers. And the fact that the state will be using a new administrative cap on carrier spending in this individual market to ensure carriers do not shift all of the reduction onto their provider networks. As members may recall, the governor is proposing to use all of the federal savings to finance 3 new programs. The first is a new reinsurance program, which will be the first in the nation to be fully funded by federal dollars with no state cost. The second will be a quality incentive payment program, which is also novel nationally. We're probably the first in the country to do it with the state in the individual market with state contracted plans. And we're also offering a loan repayment program that's focused on increasing the number of physicians and other providers, especially focused in our rural areas. This program will really be tied to those physicians that want to come to our state and live and work in especially our rural areas for at least 4 years, or they will have to pay back the loan. I will stop there. Thank you all for your time today, and we stand ready for any questions you may have on our progress thus far.
Thank you so much. I know there are a few questions, and I will go to the Majority Leader, Canizaro.
Thank you, Madam Chair, and thank you, Ms. Weeks and team, for being here to present to us on the public option and as it moves forward. I appreciate the chair allowing us to put this on the agenda so that we can continue to monitor it, since it has the public comment period had been open, then was closed, and I think there were some significant concerns over what this was going to look like as this year came to a close and whether we'd be able to meet the January 1st deadline to submit the public option waiver. And so I'm glad to hear that we are on track to make that happen. As I understand it, there were several positions that would be part of the staff that were approved by this legislature to help support the public option, and how many of them have been hired, and what does that trajectory look like in terms of that staff to support the public option?
Thank you for the question. For the record, my name is Melinda Southard. I'm a Deputy Administrator with the Division of Healthcare Financing and Policy, and the division was granted the 5 positions to support implementation of Senate Bill 420 as passed during the 2021 legislative session. The division has been moving forward in the recruitment and hiring process for these 5 positions as follows. First, the division recently hired Michael Gordon to serve in the Social Services Chief 3 leadership position over the division's newly developed federal waiver team. While this federal waiver team as a whole is intended to more broadly coordinate federal waiver application materials for certain federal waivers and program authorities under the direction of the division, Mr. Gordon's position is intended to be the primary individual responsible for the overall management, development, oversight, and compliance of the state's required Section 1332 waiver under Nevada Revised Statute 695K to implement and operate a public option and establish and finance a market stabilization program in addition to oversight of other federal waiver programs. Secondly, the division is actively recruiting for 2 Social Service Program Specialist 2 positions who are intended to also serve in the division's newly developed federal waiver team, with the distinct responsibility to perform health plan contract monitoring and oversight associated with the Section 1332 waiver and market stabilization program, with associated responsibilities creating, implementing, and monitoring policies, procedures, and programming to ensure the compliance and quality improvement efforts are maintained. Regarding the remaining 2 positions associated with the implementation of Senate Bill 420, now codified in NRS Chapter 695K, the division is actively discussing and collaborating with the Division of Human Resource Management in seeking final approval of the classification, job description, roles, and responsibilities for 2 management analyst positions. These 2 positions are intended to provide division staff who are overseeing the 1332 federal waiver program with the research, tracking, and reporting necessary to establish and monitor new quality and access metrics for the market stabilization program products, and for the design of the reinsurance quality incentive payment program for participating health carriers and the new Practice in Nevada incentive program for healthcare providers. Additionally, both management analyst positions will be expected to analyze and review data regarding 1332 federal waiver program participation and outcomes related to quality activities, monitor the availability of resources, and collaborate with the division's program integrity unit to identify and develop appropriate corrective actions when necessary. Thank you.
Okay, thank you for that. So I want to talk a little bit about the public comment period that I know just restarted in November. And as part of that, Ms. Weeks, I think you mentioned this, there was a revised waiver application and also a second actuarial analysis for the public option that included an evaluation with respect to the premium target reduction as well. And my understanding from that particular actuarial for the public option, which is sort of the second one, there was one done previously. Both of those, as I understand it, will show that we can actually meet those premium target reductions. I think there was maybe some small change in the second actuarial analysis, but I wanted to just make sure that we had that as part of the record, because I think that that's sort of yet a second actuarial analysis. And I know that was a big concern when we were presenting the public option bill in the 2021 legislative session, if I can keep my timeline straight here, that there was a request to make sure that there was actuarial analysis that supported the public option. And so now we also have yet a second one that is also showing that those premium target reductions can be part of this.
Madam Chair, Senator Cannizzaro, yes, that is correct. This one actually, the distinct differences are the reinsurance program and how we're using the money. Previously we were using the money for consumer premium subsidies, and this would go to the market stabilization program. The other real difference here in terms of federal savings that's coming back is that Milliman is assuming, given some of the things going on at the federal level, that the ARPA premium subsidies that are available in the exchange, which is not the same ARPA dollars we were talking about today, just to be clear, those are probably not going to be extended beyond 2025, the end of 2025. So if they had been, we would be getting even more money back. But because they're not, we will not be able to capture that savings.
Right, and I appreciate you outlining that as well, and certainly different than the ARPA dollars we were talking about previously. I think from my perspective, I wanted to make sure that we're sort of operating on the same page when we talk about the public option, because a big piece of that was to create these affordable healthcare plans. Part of that was through the premium reduction targets. Part of that was also, and I know it probably doesn't surprise anybody, I would have preferred the premium supports for consumers over the reinsurance support. So can you detail a little bit what the impact is of utilizing the pass-through funding from the federal government to support a reinsurance program for insurance carriers, as opposed to utilizing it for premium subsidies for individuals who might not be also receiving any additional enhancements from the ARPA dollars that had been going to them?
Madam Chair, Senator Canzaro, that's a very good question. Two things I would say about that. The reinsurance program really takes off the heat off of the premium reduction target. Essentially, the state is helping subsidize the reduction. And it's not only for just those products that we're contracting with, it's also reducing premiums across the state. So there's a different level of benefit even for unsubsidized individuals that the other scenario did not get at. And so I would just say that. So reinsurance is doing that. Reinsurance is also really taking the heat off of the provider. And I think that's an important piece that the governor and others have been very concerned about. And I will say that the reinsurance program and the benefit of that is I think, a valuable one for the waiver.
And I appreciate that, Ms. Weeks. In terms of how and what the purpose of sort of creating this public option was to help provide that affordable cost. I think the thing that sticks out for me is that premium supports, as they go to consumers, sort of provide that affordability piece for folks who just cannot afford insurance or don't have access to it because they don't qualify for employer-based health insurance. They might not qualify for other exchange programs or subsidies. And I was struck a little bit by, in your presentation, talking about that less than 5% of the revenue for these insurance companies actually comes from the individual market. So we're talking about a very small portion. And so I don't want to lose sight of what I think is sort of the overall goal, which is providing some additional options. And I think, to your point, premium reductions are an important part of that. So I understand the reinsurance piece of it. And certainly, as we see this go forward, we can continue to sort of monitor that piece of it. But I just was a little struck that we're sort of focusing a lot of these federal pass-through dollars in a place where we're talking about less than 5% of revenue for those companies. The other piece of this that I saw in our materials was and you talked about making sure that we are attracting providers here to the state. And I know that there's part of this would include a loan repayment program. Can you detail what that loan repayment program will look like for those individuals and what types of loans that loan repayment program might cover?
Madam Chair, Senator Canzaro, yes, I can. The goal, I think, in the first year, obviously, or after the first year, would be to use some of that funding to start some loan repayment program. And also the second year, we have to start the reinsurance program. But each year, we'd be hoping to add some additional funding into the state to do loan repayment. I think what you could think of it like this, and we could look at it a variety of ways, actually. We haven't really truly put out guidelines around it. But one thing that we've been talking about is offering a contract essentially with certain providers that are willing to come and live and work where we know we have open positions, especially in our rural hospital community is a good example. I just did a rural tour and a couple of communities can't even get primary care providers, right, in their community. So this would be an opportunity to say, not only can you come here and live in this great small town, but we want you to come and live here for 4 years and we'll pay off all your loans, all of them. And if you don't stay for 4 years, then you have to repay it. I will say in Arkansas, when I used to live in Arkansas, that we had a program like this when I worked for the university as a law clerk, and it did work really well. We had a lot of people that took the loan, stayed for 4 or 5 years, and they actually started their own families in those communities. You know, they actually met someone to marry, had kids, and did not leave. And so it's actually a strategy to get people to really not only come into a community to take a job, but to live and work there and really start to be part of that community.
Yeah, and I have to say that I think, loan repayment programs where we can make those work make a lot of sense. Specifically, are you talking about like student loans, education-based loans, or are you talking about other types of loans?
Madam Chair, Senator Canizaro, it would be more of the student loans that they have for the education. There could be some around housing stipend if we want to look at something like that, depending on how we want to structure this.
Okay, thank you. As much as I would prefer that the public option pass-through dollars kind of go towards the consumer premium supports and subsidies, obviously I think the important piece here, and we talked a lot about this during session as well, when we had budget hearings for the public option, is that is a requirement to be implemented, but this waiver will give us the ability to actually draw down federal dollars. And so I'm glad to see that there are pieces of that that are being directed not just at giving additional money to insurance companies, but also to supporting providers and to helping to establish that network. I think that was a huge piece of what the public option was seeking to do as well. You talked a little bit about the public comment period and that you're still in the process of sort of summarizing a lot of the public comment period. And so I assume that you are receiving a lot of negative and positive comments. Do you have any idea on whether those, like the negative comments, are coming from a particular industry, or are you getting a lot of those from individual people who live in Nevada? Do you have any sense of what sort of the demographics look like around those public comments?
Okay, Madam Chair and Senator Canizaro. Michael Gordon, Director of Federal Waivers for the Division of Healthcare Financing and Policy. In the comments we received so far, we've seen a lot of individual comments coming in, more support for those premium reductions, as families have been reporting their medical needs and how this would have helped in the past, and so looking forward to that coming forth. We have not received a whole bunch of comments from organizations at this point. That have, we're still expecting those to come in within the next few days, and so we can summarize again at the end and put that all together. But there's been a general mix, but nothing that has been brought to a upper decision yet.
Madam Chair, Senator Canizaro, I would just add to that, some of the same feedback we had before, I think from both the industry and providers, right? The concerns around the premium reduction target, can it be met, how it will be met, and what that means, I think, for obviously finances. So that's a general theme I think that we're still seeing, but like my colleague Michael Gordon said, we are waiting for the formal letters from many of these groups to summarize.
Sure, and that makes sense. I appreciate that. Again, I think I can't say that I would be shocked, because a lot of what the impetus was in the surrounding conversation on the public option was how do we help create affordability for folks in some of these plans. The last question I want to ask, Madam Chair, and then I'll let whoever else wants to have a go at it. I know it's late. The pass-through funding from the waiver, just to clarify, for the reinsurance program is not going just to plans that are public option plans. It would go to any plan that exists on the individual market. Is that correct?
Madam Chair, Senator Canizaro, Stacey Weeks for the record. Yes, that is correct.
Thank you. Thank you, Madam Chair.
Thank you. We're going to go down south to Assemblyman Hafen and then come back up to Senator Ganser.
Thank you, Madam Chair, and Mrs. Weeks. Thank you for the amount of work that went in. I didn't realize how many people were so involved in this process, and so I just want to first of all thank you for that. And I just want to make sure that I'm fully understanding the kind of the process that's currently going on here. If my memory serves me correctly, the original bill, Senate Bill 420, was a couple sessions ago, was intended to provide an option for people to purchase health insurance at a reduced rate, and there was roughly, I don't remember the exact number, but somewhere between 100 and 200,000 people that were going to be able to go out and actually purchase insurance, health insurance through some sort of market. And I just want to make sure that that's still going to be the process, is that there's still going to be, that's the end goal, is that we're going to be able to provide something to allow individuals to go out into some sort of market and purchase a reduced rate for health insurance.
Madam Chair, committee member Stacy Weeks for the record. Yes, that is still the goal, and we are still implementing the bill. I think the difference here is that we are using the savings from the federal government to implement a state reinsurance program. And that state reinsurance program really complements the Senate Bill 420 and the state contracted health plans. It complements it in a way that it helps subsidize that premium reduction, so it does make the plans more affordable without putting so much burden on the providers and carriers.
Thank you. Thank you, Madam Chair.
Thank you, Madam Chair. And I was able to talk to fiscal staff a bit about this yesterday. So the way I understand it, there's this balance between the premium reduction target and the reinsurance. And the reinsurance is allowing to, it enables the state basically using federal dollars to reduce the risk to the carriers, to the insurance carriers. And that's why we expect, in part, for the insurance rates to come down for anybody that's in the individual market, because they're actually across the board going to remove part of the risk for the larger claims.
Madam Chair, Senator Ganser, yes, that's correct. If you don't mind, I will just clarify a little bit for that. So in the first year, we are asking plans on their own to get to 3%. Originally, we were looking at 4%. Okay, so we've gone down to 3%. And then year 2, using that savings, we will come down with reinsurance, which will help buy down the high-cost claims in the market. And so that will also help all plans really reduce the cost of high-cost claims. But it will also help those state-contracted health plans meet their targets as well by half. So it's really splitting that baby in half.
Okay, and then as far as the reinsurance, you mentioned that you've been meeting with CMS pretty much every week, and that there's not a plan like this. And so what's your sense as far as the federal government? Because it's very unusual for us not to have to put some sort of state match in to get federal dollars. And it sounds like there's no state match in any of this for this program.
Madam Chair, Senator Ganser, yes, I think they think we're a little clever here. We figured it out. So what we've been able to do is figure out how to get the pass-through up front and use it to pay for it. In the past, there was no pass-through available to these states that have done these programs. They don't get the money until after reinsurance. We're using the premium reduction target to get pass-through money. That becomes our state revenue, which we decide to pay for reinsurance with.
Thank you. And then last question, how many individuals do you think this will affect? I mean, what's sort of the bandwidth, and we're doing this versus potentially expanding Medicaid for a group of people? Because are these the people who are would have the highest subsidies that would use this, or is it going to be anybody who's in the individual market? I guess it's everybody in the individual market, right? Is going to benefit from the reinsurance and for the reduction. So, who do you think we are affecting out of those who are either currently insured through the program or are not insured at all because they couldn't buy into the program?
Madam Chair, Senator Ganser, so in Nevada, our individual market, our non-group market, so people who shop for their health coverage, right, on the exchange, so those folks were going to be able to buy into this. They can also buy the product directly from their carrier under state law. That's a requirement in the bill, but it's the non-group market. And so after the first 5 years, we're looking at about 50,000 individuals enrolled.
Okay, thank you.
Thank you, Madam Chair. So I just have a real quick question, because I just need for clarification. One of the things we did, I want to say it was in 2017, we had some unscrupulous folks who were giving skinny insurance plans to people and saying that they had offered insurance and the insurance had been rejected. And so we did a bill to clarify what that meant. If you're going to offer insurance, it had to fit a certain criterion. And so I'm looking at the public option, and it appears to me that what that does is that grabs a lot of the low wage earners, particularly those who still work for employers for 39 and a half hours and don't qualify as FTE. And so, although I can appreciate, the money, the pass-through money going to the providers, I'm still very concerned about the low wage earners and their ability to at least reach that first rung. And I haven't heard that yet. Maybe I missed something.
Madam Chair, Committee Member Stacy Weeks for the record. I think one way to think about this is these plans will look just like any other exchange plan. And so individuals will be eligible that are low income, that are not in Medicaid, will be eligible for the tax credits for these products. So that will make them, just as affordable as anyone else could buy a product on the exchange. So they're all eligible for that as well. You mentioned the skinny plan, so whatever laws are in place in state law, but also under the Affordable Care Act, these plans would have to meet. So I think that these plans would not be one of those those scrupulous actors. But I'm trying to make sure I'm answering your question. But I think when it comes to affordability, these plans will be offered in the exchange and have similar premiums, only, like I said, 3% lower than what we see today, 3 to 4%, and then growing over time to 15% by the end of 4 years.
Thank you. And as I said, this is just an informational. Anyone else have any other questions? Not seeing any. Thank you so much, and thank you for your patience. It's been a very long day. Wishing you a very happy holiday. Safe drive home. That brings us up to the next item on our agenda. I don't know if you all were watching, or maybe I'm just a nerd, but on December 5th, we had the Economic Forum. So we will have staff come up and just give us a status report of the Economic Forum. And I must say, I love your tie.
Thank you, Madam Chair, members of the Interim Finance Committee. For the record, I am Michael Nakamoto, Chief Principal Deputy Fiscal Analyst with the Fiscal Analysis Division of the Legislative Counsel Bureau. And under Agenda Item U, I am here on behalf of Linda Rosenthal, the Chair of the Economic Forum, who unfortunately had prior commitments and was not able to be here today. However, there is a statutory requirement in section or subsection 1, paragraph F of NRS 353.228 that requires after the Economic Forum meeting that is to be held on or before December 10th of the odd numbered year, that a report be given by the chair of the Economic Forum or staff to the Economic Forum to this body regarding the meeting that was held, and thus that is why I am here today. I am not going to go through the entire 22-page packet that you have in front of you today because nobody wants to hear me that long. Nor am I going to go through the entire Economic Forum packet, which I believe was 210 pages. Because that would be even worse. But what I will go through is just kind of an overview of the Economic Forum itself. It is a 5-member body that is appointed by the governor. 3 of those members are the governor's selections. The other 2 are legislative selections. 1 person is nominated by the speaker, and the other is nominated by the Senate Majority Leader. And they are, in addition to the meetings that are held in the interim, they have the requirement to forecast the unrestricted general fund before and during the legislative session. The meetings that are held during the interim are updates. There are no forecasts that are required to be given. Rather, it's status reports, any information that the chair determines to be relevant. And thus, the bulk of the meeting were presentations by various agencies. David Schmidt from the Department of Employment, Training, and Rehabilitation gave an overview of the state employment outlook as of right now. Christopher Wright, the new state demographer with the Department of Taxation, gave an overview of the state population outlook. And then the remainder of the presentations were staff presentations on things like personal income, employment, wages, and so on. But the meat of the presentation and what I have for you today are the tables in front of you, which are the general fund revenues for FY24 year-to-date compared to the Economic Forum's May 1st forecasts. So you have a set of tables in front of you, and I'm just going to go through a few of them at a fairly high level. The first one is Table 1 on page 1 of the packet. For agenda item U, you can see several colors that we've highlighted there. And the first one is the FY23 actual revenues. And we go through what we determine to be the major general fund revenues. So, for example, you can see sales and use tax finished at $1.722 billion, or 6.7% above the actuals for FY 2022. The column to the right of that, the EF May 2023 FY forecast percentage change, shows what the Economic Forum thought that, or projected that the growth rate would be. And so you can see there that the forum actually forecasted growth of 8.3%. So ultimately what that means is sales tax was approximately $26.2 million below the FY23 forecast. And it would go the other way around. So for example, the percentage fees tax, which is your gaming tax, was 0.6% above FY 2022. Whereas the forecast was for growth of 0.1%, percentage fees finished approximately $5 million above the forecast. So getting down to the bottom line, basically what this is showing is that the total general fund revenues after tax credits at the bottom of that column of $5.762 billion was an actual growth rate of 5.9% compared to the forecasted growth rate of 5.1%. That was approximately $43.8 million above the forecast. We go through the same exercise for FY 2024, and this is the Economic Forum's forecast, except the logic for the growth rates is inverted. If the forecast percentage change in that first column is lower than the forecast percentage change based on the 2023 actual, it means that that actual for FY23 was below the forecast, and then vice versa if those are flipped around. On page 2 is the meat of these tables. And for these tables, one of the things that I will note is at the Economic Forum's meeting on December 5th, we had presented information to that body through October of the fiscal year. So it would have been the first 2 months of sales and use tax, the first 4 months of the gaming percentage fee, and so on. And this was for a number of reasons. We were having some technical issues getting the right data from the various agencies. We were able to resolve most of that. And so the information that you have is more updated, so it's through November 30th for both FY23 and FY24. But what you will note there is for the FY23 actuals and year-to-date, and for FY24 for that matter, for the insurance premium tax and all of the categories of the modified business tax, we're reporting zeros, and that goes back to some technical issues that we ran across last fiscal year. The Department of Taxation had some issues with taxpayers who did not pay in a timely fashion, or more, they paid timely, but they didn't necessarily file timely, so that we don't have distorted information for the collections comparison between FY24 and FY23. We're reporting both of those as zeros because we don't want it distorted. We'll have a better set of information when we get to the second quarter, which would be later in the fiscal year, obviously, but so that we're not over-reporting the collections and then coming back and saying, no, we were just kidding about that several months months from now, we're just reporting those as zeros because a lot of those collections in FY23 ended up getting reported in the second quarter and would give us a more apples to apples comparison. So basically what on this table, what we're looking at, it's the same information. So the yellow column is the FY23 actual year to date for each of these revenues through the reference period. And then FY24 actual year to date collections are in the orange, pink, salmon column, whatever color you want to call that. And then we do a comparison of those as a FY24 forecast year to date in the green columns. And then the dollar difference actual less forecast, so the next to last column is the how far we are or above or below the forecast. So for the sales and use tax through 3 months, for example, we're approximately $6.5 million below the forecast. For the percentage fees through 5 months, we're approximately $17.3 million above the forecast. The live entertainment tax, the total you can see is approximately $17.5 million above the forecast, broken out between the gaming portion administered by the Gaming Control Board and the non-gaming portion administered by the Department of Taxation. So for the major revenues, you can see that we're approximately $28.3 million year to date above the forecast through November, excluding, of course, the MBT and the insurance premium tax. And then for the select non-major general fund revenues, these are some of the smaller revenues that are collected by the Department of Taxation, the Secretary of State's office, and so on. For those that we list there, we're approximately $7.8 million below the forecast. And then below that is the total all other general fund revenues, which are anything else on the economic form sheet. Those of you who have been around long enough have seen the list of over 100 revenues that go into the state general fund. That's everything else. And when you put those together through the end of November, we're approximately $7.3 million above the forecast. So the total after commerce tax credits, you can see right now we're approximately $27.8 million above the forecast year to date. Again, it's early in the fiscal year. We don't have a lot of the revenues in. We have nothing in this sheet for the MBT, the insurance premium tax. This doesn't account for some of the larger minor revenues that we are accounting for, such as treasurer's interest income, which is high because of the amount of ARPA money that is sitting in the state treasury and drawing interest that accrues to the state general fund. And to be frank, this is through, for sales tax through the end of September. So some of the larger events that have happened, such as Formula One, we will not see that in taxable sales until the end of January. And then the Super Bowl, which is going to happen at the beginning of February, we will not see that in collections until the end of April. So these are things that we're keeping our eye on. But this is kind of where the lay of the land, so to speak, right now. The other tables, I'm not going to spend a lot of time going through. Table 3 on page 3 is basically what the collections have to be for the rest of the fiscal year to get to the forecast, and then the growth rates that are associated with that. Tables 4 and 5 are replications of table 1 and 2. The difference, though, is those account for the tax credits that are applied to a number of tax types that are part of the state general fund. Tables 1 and 2 are before tax credits. In this instance, what we do is because of the mechanism of the tax credits and the way that they're forecasted, we have them balancing. So if you look at that bottom line number, it's going to be the same. When we get to the end of the fiscal year, though, those numbers are going to be different. So we include them in the packet just for reference, but the numbers really aren't going to change from tables 1 and 2 in tables 4 and 5 until the end of the fiscal year. Table 6, which is on page Table 6 is on page 6, and that is just an accounting of the tax credits as they're being used. Because most of the tax credits can be used against multiple tax types, we just go through and break out how many film tax credits, for example, have been used against the modified business tax versus the insurance premium tax versus the gaming percentage fee. And then finally, on page 13 of the packet is Table 7. This is just an accounting of all of the revenues that go into the State General Fund year-to-date through the end of November for FY23 and 24. So this is every revenue item that goes into the general fund line by line, and so we just show the comparison. In the interest of time, Madam Chair, there's not anything else that I wanted to go through, but I will stand ready for questions. Thank you.
Thank you so much. We do have a few questions. We'll start with Assemblywoman Anderson.
Thank you, Chair, and thank you for the presentation, although got it also great tie. So looking at table 2, and then also looking through the backup documents, can you kind of make a guesstimate as to why the live entertainment tax was so incredibly high, or is that because of the Taylor Swift, which, by the way, it's Taylor Swift Day, just had to put that out there, as well as Queen Bee's concert? Is that why that's such a huge amount than what was anticipated?
Thank you for the question, Assemblywoman Anderson. Michael Nakamoto with the Fiscal Analysis Division for the record. That is a good question, and I'm not sure that I have a really good answer for you. A lot of the events that I could discuss, either on the gaming side or the non-gaming side, may or may not figure into this, and part of it is timing. For the non-gaming portion administered by the Department of Taxation, the tax is remitted to the department when the tickets are sold. For the gaming portion administered by the Gaming Control Board, the tax is administered when the event occurs. So, for example, before the meeting, I was in Las Vegas and I went to see Depeche Mode at T-Mobile Arena. And so the LET that was paid for the ticket that I bought was remitted to the Department of Taxation as soon as I bought the ticket several months prior. But the ticket that I bought for Barry Manilow the following evening, don't judge, was purchased. I bought that ticket right away, or right before the concert, but the casino is not required, Westgate is not required to remit those proceeds to the Gaming Control Board until after the event occurs. So that is something we're trying to figure out because so many of the tickets for these events go on sale months before the event. So Taylor Swift, for example, I believe that we were still in session when those tickets actually went on sale, even though the concert was later. And the same thing with Formula One. Even though the event happened in November, a lot of the tickets for that went on sale during the spring. So we were actually seeing some collections, we believe, for Formula One in FY23 rather than FY24. In terms of why that's so overproducing, I think it's just we could sit here and talk about any number of events that are subject to the LET, be it Beyonce or Taylor Swift or Barry Manilow or Carrot Top or anybody else that you want to mention. And the list of those just seems to increase, and that's something we try and keep tabs on. But I think Las Vegas does a very good job of bringing events to the Strip and to facilities in the Valley.
Thank you, and thank you for letting me know about you getting a chance to see Depeche Mode and Barry Manilow. So thank you so much for that information.
Speaker Yeager, do you have a question?
Thank you so much, Madam Chair. Thank you, Mr. Nakamoto. I was also at Depeche Mode. Great concert. My wife really enjoyed it. I mostly enjoyed it. Question that I have on the sales and use tax. You said it was through the first 3 months. I think you said through September. And I noticed that, it's not down a lot. It's 1.5%, but the number looks big, 6.5 million. And just wondered if you could confirm. I would assume that historically in Nevada, the summer months would have less collection in terms of sales and use tax because we tend to have less visitor volume in a place like Las Vegas during, July, August, and I guess into September. And so I just wondered if you had any perspective historically if the sales and use tax in particular, if that is a trend we tend to see in the summer months.
Speaker Yeager, for Michael Nakamoto for the record, thank you for the question, and that is also a very good question. You're correct, there is seasonality to the sales and use tax. There is seasonality to most of the taxes that the state collects, and that is one thing that we do observe with the sales and use tax. Visitor volumes are down in this state. For the simple reason that not a lot of people want to come to Nevada when it is 110 degrees. In fact, that is the time that a lot of the time I like leaving the state. Because of the methodology we use, it doesn't necessarily account for that seasonality. Basically, what we do when we compare the actuals compared to the forecast is we say that because if whatever growth rate that the forecast is for the sales and use tax, let's just say that it's the forecast is for 5.5%. We expect all of the months to grow by 5.5%, and that's how we determine a year-to-date forecast. Realistically, we know that's not going to happen because, as you correctly note, there are months that are going to be busier. July, August, and September do not look like November or December or January or February on the Strip when there is a lot of activity from tourists. And likewise, when you walk into any retail store, July looks a lot different than November or December just because of holiday shopping. So that's one of the things that we keep in mind when we start looking at these year-to-date actuals compared to the forecast. And you're correct, $6.5 million is a lot of money, but when we're talking about a forecast of $1.7 billion, it isn't a huge amount. So we're keeping that perspective, but it is definitely a tax source that we are keeping our eyes on because it did end FY23 down, like I said, about $26 million. So it's something we keep our eyes on, but you are correct, the seasonality could very well be playing into it.
Members, any other questions? Not seeing any. Thank you so much.
Thank you, Madam Chair.
Appreciate it. I didn't get to sit through the entire economic forum with you because I was multitasking, but appreciate the work that you do on it.
Thank you.
Well, that brings us up to the last item on our agenda, which is the second public comment. And I'll remind anyone who wishes to make public comment to limit your comments to just 2 minutes. We have no one here in Carson City that would like to make public comment. Is there anyone in Las Vegas? I invite you to the table.
Good evening, legislators. Again, my name is Terry Schuman, and I am again going to be speaking on what happened this morning as item E was pulled from our agenda. To say the least, our support staff who showed up this morning was not happy at all. This morning I came with hope and expectancy, thinking that since the funds had already been approved, that it was just going to be a formality. To say the least, I am still in shock. How dare you to stab myself and 13,000 other support staff employees in the back just because teachers can't get their act together? Superintendent Jara, as I was told, had turned in everything that he needed to turn in, except for the part that he couldn't because the teachers have not reached their contract. That is not support staff's fault. Support staff has nothing to do with that. But yet to withhold the money from myself and the 13 others who work in CCSD was wrong. Senator Lane, you are the senator in my area where I live. I have always looked up to you. I have always supported you. I have always told everybody at the schools where I've been that Senator Lane, I'm so lucky to be in her area because she supports our support staff. But yet today you turn your back on us too. I don't understand that. I have endorsed you by voting for you, but yet today I couldn't get your vote. I have heard it said that because teachers cannot get their act together in getting a contract, that again, it's reflected back on our support staff. Sorry. I just want to say, how can we justify this? How can I go back to my school tomorrow? Because just 2 days ago, Monday, we were talking about what's going on with SB 231. And I'm thinking, well, okay, Wednesday, by Thursday, I'll let you know, because I know that you're looking forward to that money. Christmas is right around the corner. Do you think they're going to have a very Merry Christmas when they know that money that was due them is not coming? And it's us who come to represent our other support staff who can't come. It's us who they get mad at us because we have to tell them that. That's not fair either. But yet, what can we do to separate CCEA over here, support staff over here, not in the classrooms, of course, because I work great with my teacher. I told you this morning the story about Josh and how he has to come to school after working a night job just to support he's living with his brother. He has to pay half the rent, and that's what it costs. So how can we support our support staff when we can't get y'all support? And I think this needs to be done before the next session in February. It should be done as close to January, right after Christmas, as possible, because our support staff was looking forward to being a part of this. And also a statement to Senator Canizaro. I appreciate the way that you emphasize to other districts that all support staff should be involved with this SB 231 money. There's some questions going on within CCSD. I don't have the exact question to ask, but I know that there's been confusion whether or not all support staff will be receiving the money. So we need to make sure that this is taken care of. As you so profusely acknowledge all support staff. And I just, I look up to you guys. I enjoy visiting you in Carson City. I enjoy coming to speak in front of you because I take it upon myself to represent the other support staff who cannot be here. But we need your help. Don't turn your back on us because we need your vote. And again, separate us from what CCA is doing. They have not had it together in I don't know how long, but our support staff is working hard to keep it together, and we need your vote. Thank you.
Thank you. And thank you for staying all night with us to make that comment. Is there anyone else there in Las Vegas? And if I am correct, there's no one on our phone line. Is that correct, broadcast?
Yes, Chair, that is correct.
Thank you so much. So that brings us to the end of our meeting, and during our lunchtime, we stepped away for a 2 o'clock lunch so that we could all be a part of the vigil for the UNLV tragedy that happened. But I also want to mention that that's not the only tragedy that we've had in our state in this last month. We lost 2 heroes in our community. 2 of our public safety officers put on their uniforms, went to work, and had every intention of going home to be with their families. And unfortunately, due to the acts of a person who appears to have been under the influence, they gave their lives in protection of our country. And just before we adjourned, if we could just do a minute of silence for them, their families, their children who will have to grow up without their fathers, but also for the families of those that we lost at UNLV, the students who were traumatized, for the parents as they had to wait and will now have to work through the trauma that their children go through. If we could just have a minute of silence before our adjournment, I would be appreciative. Thank you all. I wish you all a happy holiday, safe travels back home. And with that, this meeting is adjourned.